Thank you very much. We're going to start here, and I have a document that I need to read before we start our meeting for the board meeting here. Good morning. I am Patsy Zeller and serve as president of the Kansas State Board of Nursing. I ask the members of the board to respond to a roll call to signify their presence at this open meeting that is being conducted remotely. Rebecca Sander.
Present.
Juliana Resnick.
Present.
Adri Goldsmith.
Present.
Gwendolyn Lloyd. I don't see her there. Andrea Watson.
Present.
Melissa or Preza, sorry if I mispronounced that. Melissa, are you there? Lori Owen. No, I don't see Lori either.
I'm sorry, I couldn't unmute. This is Melissa.
Okay, very good. Thank you. We'll go back to Lori. Is Lori Owen there?
Madam President, this is Carol Moreland, and I think there was something came across from her on the chat. She's present, but she's unsure if she's incorrectly. Could we check with her or something, Adrian, or something? Because she may not have joined correctly.
She's joined on the other side.
I got her. Colton, can you?
We can get her across.
Hang on, Lori, we'll get you fixed. I say we loosely. I asked, and Colton and Adrian does that.
Okay, now I'm here.
Very good, thank you. Giovanni Gone,
Present.
Gita Noble,
Present.
and Jade Ramsdale.
Present.
Thank you for that. I also asked the following staff members who are also present to respond. Carol Moreland, Executive Administrator.
Present.
Adrian Guerrero, Director of Operations.
Present.
Linda Davies, Practice Specialist.
Present.
Janelle Martin, Nursing Education Compliance Officer.
Present.
Chelsea Stephenson, Education Specialist. Jill Simons, Executive and Assistant.
Present.
Before we begin the meeting, I want to make the following statements regarding the meeting that is being conducted remotely. Public comment allows individuals to address the board about their concerns, but the Kansas Open Meetings Act, which is known as COMA, does not require the board to provide public comment or answer questions from individuals. Today, we will not have public comment due to the length of the meeting and possibility that the connection to the remote meeting may be lost. Because we are conducting this public meeting by Zoom and YouTube, I state for the record the following information. On August 28, 2021, the board sent notice of the meeting for the board to all individuals who had requested notice of the board's meetings. Additionally, the notice and agenda were posted on the board's website, ksbn.kansas.gov. The notice contains the internet link to attend the meeting by Zoom and YouTube. The notice also contains the Zoom telephone number to attend the meeting. These electronic mediums allow the public to attend the meeting free of charge by either video conference or telephone. The notice also advises individuals to contact the board's office at 785-296-2967 if they experience any technical difficulty during the meeting. You may obtain a copy of the notice and agenda at the website or by sending an email to carolmoreland@chaos.gov with a subject line request for the agenda, and the board staff will send it to you. The only mediums for interactive communication offered for this meeting are the connections by Zoom and YouTube as previously stated. Each member of the board, board staff, or presenter shall state the person's name and title each time the person speaks or votes, as the case may be. Each participant to this meeting shall ensure microphones, phones, or other electronic devices are on mute when the participant is not speaking. Each motion will be clearly stated before the board votes, and the president will announce the results of the final vote. A statement or motion will clearly identify and authorize by delegation each member of the board or staff who will be permitted to sign any document on behalf of the board. The meeting is being recorded, and the recording will be posted on the board's website. The board has the following items listed on the agenda. Call to order, review of on-site packet, additions or revisions to the board's agenda, announcements, approval of minutes of the board's meeting in June of 2021, consent item agenda, agency reports, committee reports, unfinished business, new business, executive session if needed, agenda for December 2021 board meeting and adjournment. As noted above, the board may take an executive session. If the board elects to exercise this option to go into executive session, the board will follow this process. First, the board must be in open session before going into executive session. Then a motion will be made and seconded pursuant to KSA 75-4319B. The motion must contain the state of justification for closure, the subject to be discussed, and the time and place that the open meeting will resume. If a motion for executive session passes, public will be excluded from the portion of this meeting as the executive session will be conducted by electronic means that will not be made available to the public. The board members will return to the open meeting after the executive session. The open meeting will resume when the board members return to the Zoom and YouTube meetings after the executive session. The complete motion for an executive session will be recorded in the minutes, and this meeting is now called to order, and the board will begin the meeting with the next item on the agenda. I don't have that memorized, but almost. Okay, before we get started with the agenda, I just wondered if we could go around the Zoom here. I'll call your name, and if you could just tell us how long that you've been on the board. So if you're brand new and just this is your first boarding, let us know so we kind of get put a time with the face. And I'm going to start. It says Patsy on the screen. My given name is Patricia. So if you send me an email, that's what it'll have to be. And I've been serving on the board. In June of 22 will be the last I will be here. And that will be 8 years as a board member and 2 years before that as an education committee member. So I've been doing this a while. Do I have it figured out? No, I learn something new every day. In fact, they did an administrator update on Monday for some of our administrators in education. And I wrote down some things that were ahas I knew, but I guess I kind of forgot. So it was great to do that. So Rebecca Sander.
Hi, I hail from Western Kansas. I'm out here in Hayes. So this is my second term on the board. I have served on the Education Committee and the Investigative Committee, and currently I am preside over the Investigative Committee. So we stay busy.
Thank you. Juliana Resnick.
Hi, I have been on, this is my 5th year on the board. I was just reappointed a couple months ago. So I am on the Investigative Committee and I chair the CNE and IV Practice Council Committee. For my day job, I am VP of Nursing for Ascension, Via Christi, St. Francis, and St. Joe, now both campuses in Wichita. So,
Thank you. Audrey Goldsmith.
Still muted, sorry. Had too many mouses. This is my first term. Honestly, I can't remember the date that I started. I'm an LPN working primary medicine. I find it an honor to be on the board. I learn all the time and like to share, that this is one of the best things that I've been able to be a part of.
Thank you. Andrea Watson.
Hi, I'm Andrea Watson. I'm in my first term. This is my second year. And in my day job, I work with clinical trials in the St. Luke's Health System.
Thank you. Lori Owen.
I'm Lori Owen. I'm an LPN. I was just appointed in July, so very first meeting. So I work at a care home plus in Emporia and live out towards Council Grove. So I'm excited to get started.
Welcome. Thank you for that. Giovanni Gone.
Yes, good morning. It's actually Giovanni Gone. And so my last,
sorry.
Yes, it's okay. It's okay. I am based in Garden City, Kansas. I was appointed to the board in July of 2020. I have a master's degree in public health, and I am the Chief Administrative Officer for Genesis Family Health, which is an FQHC in the western part of Kansas. And I serve in the CNE and the Finance Committee.
Thank you. Gita Noble.
Good morning. I'm currently serving my first term on the Kansas State Board of Nursing, and I also serve on I did serve on the Education Committee. I think I'm going to be on a different committee here shortly, and on the Finance Committee. My day job is as the Internship Coordinator at Seaman High School, and I've served in this role for the past 6 years. Been an educator for, I believe, 32 years in the Kansas public school system, based in Topeka, and happy to be on the board.
Thank you. Jade Ramsdale.
Hi, good morning, everyone. This is my first term serving as a public board member. I joined back in, gosh, the time has flown, 2020. 2019 is when I initially started. So this is my second year. I currently serve on the investigative and APRN committee. And during the daytime, my full-time job is as a human resources information analyst. So I'm very excited to be here and to continue to learn with you all.
Thank you for that. I see Gwendolyn's, her pictures. So Gwendolyn, you want to tell us how long you've been with the board? You're muted.
I have been on the board. This is my first term, and I serve on the practice and C&E committees, and I am a travel nurse in my day job. I've been working with COVID patients in the ICU.
Okay, thank you very much for that, for letting me take care of those introductions so we can follow the rest of the agenda for today. So,
Do you mind if I introduce myself?
oh, I'm sorry. Did I skip you, Melissa? I'm so sorry. I marked you off like you were done. No, that would be great. Thank you. Sorry.
Hi, I'm Melissa Orface, and this is my first board meeting. I was just appointed in July, like Lori. I am a nurse practitioner at the University Medical Center, or University of Kansas Hospital Systems, Health Systems. I'm a gastroenterology nurse practitioner. I just finished since 2012. And I just finished my DNP program in 2020. I'm wrapping that up during the pandemic. And excited to be here and get started. Thank you.
I'm so sorry for that admission. You can see that even though I've done this a couple times, if I get out of order of something, please holler and let's get it straight before we go too far down the road. I appreciate it. So now officially we'll call a meeting to order. And the first thing on the agenda is a review of the on-site packet. I think we had one thing in that packet. Is that correct? Was there a couple things, Carol? What was in there?
Carol Moreland, administrator. There's one thing in your on-site packet. It is about CE broker, which we're going to talk about here in a little bit. To find that on your iPads, it would be under on-site packet and then on-site board. It's just a one-page information flyer that is going to make a lot more sense here in a little while. Thank you.
Okay, thanks for that. Additions or revisions to the board agenda. I have a couple things myself. The CE broker rep is going to talk to us, and we have him scheduled for 10:30 this morning. So wherever we are in the agenda, we'll stop, make time for that presentation. And then at the kind of the last of the agenda under new business, we have number 5 is appointment of agency head presiding officer, and number 6 is election of officers. And I need to switch those around and do the elections first before the appointment of agency head and presiding officer work that we need to do. So we're going to turn those two around. Anything else on the agenda that we need to change? Did I miss anything? Okay. Jill, I think we need to have a motion because we made some revisions.
Yes, is there a board member who would like to make the following motion? I move to approve the agenda as amended.
This is Rebecca, board member. I so move.
This is Juliana, board member. I'll second.
Motion is second. Any discussion? All in favor, say yes.
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 All opposed, say no. Okay, that motion carries. Announcements. Carol, I'm going to lean on you again. Is there some announcements we need today?
I don't think so.
Thank you. Approval for minutes of June 16, 2021. This should have been available to you in your packet. Did anyone see any changes that we needed to make, typos or anything there? Hearing none, Jill, I'll let you read another motion.
Is there a board member who would like to make the following motion? I move to approve the minutes from the June 16, 2021 board meeting as written.
This is Gwen Lloyd and I move.
I have a motion. Do I have a second?
Giovanni Bonet.
Giovanni, we have her as the second. Motion second. Any discussion? All in favor, say yes.
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 Opposed, say no. That motion carries. Thank you for that. The next thing we have is agency reports, and we're going to start with Carol, the administrator.
Good morning, Carol Moreland, the administrator for the agency. And just as a little bit of explanation to Lori and Melissa, kind of about our staff reports. Our agency is actually divided into several divisions, like licensing, discipline, education, investigative, administration. And so we have several of our leadership team who is here with you today, and they each prepare a report that kind of overviews what's happened in the last quarter since we last met, just so that the board is aware of what's going on. And then they each present that at the board meeting, but it's also always in your packet so that you can review it ahead of time. So if you have any questions, anything along that line. And I thought it might be helpful when each staff member does their report, if they just kind of tell a little bit about themselves, maybe how long they've been at the board, what they do at the board and stuff like that. That might be a little bit helpful for you to kind of get to know us a little bit better since we're not actually in person. So just to let you know, I've actually been at the board, I believe it was 11 years yesterday. I can't believe it. It's went pretty fast. But actually, when I started at the board, I was in the education division and I worked with the nursing programs. And I did that for 7 years, thoroughly enjoyed it, but somehow felt I needed more challenge in my life or something. I'm not sure. So anyway, I applied for the administrator when my predecessor retired. And I have learned so much. It's very challenging, but again, I've been a nurse like my whole life almost. I went to nursing school right out of high school. And coming to the Board of Nursing is unlike any other kind of nursing that I've done, truthfully. But I have learned a lot. I have some wonderful staff that I work with that really make this much easier. And just to kind of let you know, Jill Simons is on here and she is my assistant. And Jill's actually been at the board almost as long as I have. We kind of almost started together. And she makes my life much, much easier. I couldn't do my job without her. She is such a tremendous help to me. And she does not actually have a report, but she is the person behind the scenes that makes this all come together, so to speak. She really puts timelines together for everybody to have everything ready for you and all of that. So just to kind of let you know a little bit about that. So you do have my report. All of our staff reports would be on your iPad under staff reports. So you can pull them up if you want to, or you can just listen or whatever. Mine always starts out with upcoming meetings that are there. And we are actually part of National Council of State Boards of Nursing. And they do a lot of meetings. And so I always list the meetings here. And if it's a meeting that you're interested in attending or something like that, let me know and we can talk about it and see who the meeting is open to and different stuff like that. But the two listed there for the rest of this year are going to be virtual. I'm not sure about the other ones yet, if those are going to be virtual, in person, or anything like that. But I always list those at the start of my report. And then just a little bit on the agency response to COVID. Yeah, I thought that we would kind of be done with this by now, but we're not. So anyway, I'm not going to go through all of that. Basically, in May, we were told, and in March of 2020, we were told to take our staff out of the agency as much as possible to decrease the chance of COVID exposure and the spread of COVID. So we did. We purchased a lot of very nice laptops, equipments, and everything like that. And we had 70% of our staff working remotely and have done an awesome job with it. They really have. And we have to keep a few back in the agency because the agency is open to the public. So we have to have somebody there. Plus we have a couple of staff who actually wanted to be in the agency. They didn't want to work remotely, and that's fine. We respect that. But we also need to have some support staff in the agency to be able to support some of the 70% working remotely. And then in May of this year, we were told that we could bring them back if we wanted to, but we could leave them remotely. And so I gave a lot of thought about this, talked to the staff, and actually gave them 3 options. And each of them could choose their own option. One was to remain hybrid, but they had to come back in the agency a minimum of 8 hours a week. I felt like there needed to be some contact back in person in the agency. Or they could do traditional, which means they would be in the agency 5 days a week, 8 hours a day, just like we used to be, so to speak. Or they could have flex hours, which would be 4 10-hour days, but those would all be in person in the agency. So they chose what they wanted. It's no surprise that most of them chose the hybrid, and that's fine. And so we started down that path in July. And then the last of August, we were notified. Just to let you know, we are part of the executive branch. And so anytime there's any guidance that comes out from the governor, the Department of Administration, about how we should handle our response to COVID, we are included in that because we're part of the executive branch. So there was some guidance that came out the end of August because of the Delta variants that they wanted us to take as many of our staff out teleworking again as possible. They will reevaluate that October 4th. So I don't know how that's going to go, but right now, again, 70% of our staff are working remotely. They are not required to come in for the 8 hours a week like we had planned. So if they reverse that, then we will go back to what we were doing as far as if they chose hybrid, they'll be back in for 8 hours a week. So we'll just kind of wait and see how that goes. But, the staff has done a tremendous job. We are watching the performance metrics very closely to make sure that there's no dip in those because of teleworking. There were some challenges getting everything electronic for some of the divisions was a little bit more challenging than others. So we had some things to work through there. Okay, the other big thing that's been going on since we met in June was the end of the executive order that had to do with extending the licensure expiration dates. Those of you that have been board members, you remember like in April, Governor Kelly put out an executive order that actually allowed the expiration dates of licenses to be extended. Well, that continued clear through May of 2021. And then the board decided to give the licensees 90 days so that we could adequately notify them as much as possible. So the end of the expiration extension was actually August 28th. And we did a lot of communication about this, a lot. We had it on our website, we pushed it out, we've had it in our newsletter. I have communicated to employers through the Hospital Association, through long-term care associations, different stuff like that, just trying to get the message out. And so this basically affected any licensee whose license had an expiration date of May of 2020 through July 31st, 2021. That's a lot of licensees. However, they were given the option to continue to renew their license on their normal schedule if they wanted to. So as we got closer to this date, we were very concerned about the impact that this might have because we knew there were a lot of numbers out there and we weren't exactly sure how this was going to play out, but we felt like we had done everything that we could to communicate. So what that actually meant is for someone who didn't get their license renewed on August 28th, their license would be lapsed on August 29th and they could no longer practice. We knew that this could have a big impact on some healthcare facilities that are already stretched very thin. However, what we found, just to let you know, we did drop off 9,518 licensees, but before you get too, don't just listen to the rest of this, please. About 6,000 of those have multi-state licenses, and so they should not have renewed their single state. So that was good. We caught those because we haven't seen the full effect of joining the compact yet. I mean, this is part of what we're seeing right here. And we knew that we were going to see it at some point within those 2 years of joining the compact. So now we've seen it, and that's okay. We normally drop off probably about 300 a month. And, people who retire, people who move, they just don't want to keep their nursing license, whatever be the case. And so if you take that over 17 or 18 months that this went on, you can see that probably the 9,500 was not too bad. We've actually, if they did not renew their nursing license and they still wanted it and they lapsed, then they have to do a reinstatement with us. We have actually issued 113 reinstatement applications. So actually, I don't think we did so badly here. I think we're just seeing the full effect of the compact is a lot of it. But we had over 4,800 licenses renewed in the month of August. So that's a lot. Just to let you know, there's no more license extensions. Now we're working on getting the communication out there that, if they chose to wait and renew their license, that does not reset their license expiration date. It is in statute and regulation that it always expires on your birthday month, the end of your birthday month, and it expires in an even or odd year based on whether you were born in an even or odd year. So if somebody that was supposed to renew in March of 2020 chose not to renew until August of 2021, their license will be up for renewal again in March of 2022. So they have to have 30 hours of CNE. And so they have a very short time to get that done. So we're trying to get the communication out now about that. It's just real important that nurses check their expiration date if they don't know for sure when it is. So that's kind of been a big thing going on. But right now we have over 70,000 licensees. 70,478. And just kind of let you know the progress of the multi-state. We have over 10,000 RN multi-state licenses that we've issued and over 1,000 LPN multi-state. So the multi-state is becoming definitely more popular. Just kind of go into the next part, the Nurse Licensure Compact update. There's now 38 states and 1 territory that are part of it. I actually put a map in on page, let me see, page 5 in my report, and you can see the map. Every state that's in blue is part of the Nurse Licensure Compact. It has really gained momentum because of the pandemic. It's been much easier to mobilize nurses where they're needed. It has been a lifesaver for us, I feel like. We've been very busy because of the pandemic, but we've been able to bring some nurses in that did not have to seek licensure through us because they were part of the Nurse Licensure Compact. They were just in here practicing. They didn't plan to move to Kansas. So it's been much, much, much better for the employers. So that was a great decision that the board made several years ago to go with the compact. Just to let you know a little bit about the budget. I just submitted fiscal year 22 and 23 budget last night. It's due today and it looks good. I did ask for a change package, which is an enhancement to the allocated amount for fiscal year 23 because we want to do an upgrade to our licensure software. Our licensure software is extremely important to our agency. It's utilized by everyone across the agency. So it's very important that we keep it upgraded as much as possible. The upgrade would give us some enhancements to what we have now. So we're wanting that. Another thing that was new in the budget this year is we've always done performance-based budget, which means you have to submit your performance metrics and your assessment of how you've met those with your budget. But what they ask us to do this year, which is new, is the cost per output. So it was very interesting. That would be like the cost per license and different stuff like that. Since I just got this submitted last night, I did not have anything to put in your packet, but my plans, and I talked to the finance committee about this, is to put some of this information in the finance packet for December so that the board can see that. But just kind of let you know the process for the budget going forward. It was submitted to Division of Budget. They have until, it's usually around Veterans Day, and then they come back with their recommendation. The agencies have a few days to do an appeal if we don't get what we want. And then they do their final recommendation to the governor's office. And the legislative research works then to put together the governor's budget. And then she gives the governor's budget right after she does the State of the State address, which is shortly after the legislature starts in January. And then during the legislative session, I will be going over and presenting on our budget to the legislature, both on the Senate side and the House side, and answering any questions they have and stuff like that. And then the final appropriation for fiscal year 23, we're in fiscal year 22 right now, and that appropriation was done last year. So we're within our appropriated budget for that. But then fiscal year 23, they will do the appropriation for that budget at the end of the legislative session, like probably around April, end of March, April, something like that. So we'll know then what we get for fiscal year 23. Let me see, undergrad education regulations. This is another thing that's been going on. This is a reminder, these were actually probably started 3 or 4 years ago, and they came out of the Education Committee, and they really started these proposed regulation changes to provide some clarification, because there were some definitions and stuff that we didn't have that really needed to be clarified in there. And one of them was the nursing program administrator. We really did a lot of work on that so that role is clarified, I think, very well. And then the Education Committee wanted to bring the Kansas standards up to the national standards as far as pass rates, how much simulation can be utilized. Those are probably the biggest things there. So after they came out of the Education Committee, they went to the board. And then we started them through the process. And for those of you that are new or anybody else who's not really familiar with the process, anytime you do changes to regulations, they have to go to the Division of Budget along with an economic impact statement. And then if it's okay there, then they get stamped and then they go to Department of Administration. Department of Administration looks at the grammar and all of that. And typically there's changes that need to be made at that point. But once we get them through there, then it's stamped from there and then it goes to the Attorney General's office. The Attorney General's office looks at the legality of what we want to do. Do we have the authority to do that? And if everything's okay there, then it's stamped through the Attorney General. If there's changes made at any of these stops, then it has to start all over again. And that happened several times with these. We had to make changes several times. But they finally made it through all of them. And so the step after that is to set up a public hearing. And we have to have it, the public hearing has to be published in the Kansas Register. And so we have to give it at least 61 days after it's been published in the Kansas Register before we can do the public notice. So these were published in the Kansas Register on August 19th. So the public hearing is set up for October 25th. You have in part of on page 6, this starts all this information. You as board members do not have to attend that public hearing. What that is that is an opportunity for anyone to make comments about these proposed regulations. But they also have the option to submit written comments anytime from once this notice was published. So far, I've not received any. The written comments would come to me, and the directions are all on that public notice. They come to me. They can be through email. They can be sent in the mail, whatever they want. But all of these public comments then will be put in a packet for you as board members to review. And we'll talk about that in a minute. I did go over last Friday and present these proposed regulation changes to the Joint Committee on Administrative Rules and Regs, which is part of a subcommittee of the legislature. They had some very good comments. There's no nurses on there, but there are some that have an education background, and we're very supportive of some of the changes that you asked to be made. So they will also prepare kind of a follow-up report to me with any comments that they have that will also go to you as board members. So after this public hearing, we will get all of the comments and we will put them together and put them into a packet. Now all of these proposed regulations have an implementation date of January 1st. So you have to work backward from that date. They have to be published in the Kansas Register the final time with your decision at least 15 days before then. And we're falling into some holidays and stuff like that. So I'm telling you all of this because we can't do it at the December board meeting. We will not have enough time to get these through and get them ready to be implemented by January 1st. So there will need to be a special board meeting about this, preferably the week of November 15th, the first part of that week. It can be a Zoom, it could be a conference call. It would be just truly to look at the comments, but the comments would go out to you before, so you have a chance to look at them. And then you as the board will decide, do you want to just think about it more? Do you want to approve the proposed regulations, or do you want to make changes? If you make changes, it starts all over again, which is fine if that's what you want to do, but I just want to make sure you're aware of this. So I'm not sure, Madam President, what you want to do about a special board meeting, if you want to look at a date now, or you just want me to work with the board president a little bit later, but it would be a short meeting. It would probably not be a very long meeting. But I just wanted to make you all aware of where we're at with that. I think we're getting close.
Carol, do you have a date in mind right now, or do you need to find one and see what we can do, or could we set something now with the group?
I would say November 15th or 16th, because that will give me time to, because once you all make the decision, then there's a little bit of paperwork and stuff that I have to get together, send to the Secretary of State's office so it can get in the Kansas Register, and that doesn't happen. The Kansas Registrar, I have to give them 10 days to get it published because of the amount of volume of these regulations. Plus we're falling with Thanksgiving holiday and all of that in there.
So as a general consensus, is the group okay with her finding a date? The struggle here is that we need to make sure we have a quorum so that we can actually vote and have some decision from this team. So is there some preference, morning or afternoon, or can we just let Carol find a time and send out the invite, or what do you want to do? Any comments? Well, Carol, looked like, I'm sorry?
I was just gonna say, I'll do my best to work with whatever she sends out. I would prefer an afternoon, but I can work with whatever.
Have you guys ever done one of those monkey surveys where it gives dates and times and you just kind of go with what the group wants after everybody picks something?
We can try that, definitely.
If you've tried that in the past and it hasn't worked, that's fine. I just thought I'd throw it out there.
No, I don't think we have, but we can certainly look into that. Thank you, Melissa. That's a very good idea, because we do, like Patsy said, we need to get as many of you as possible on this meeting. Again, it would not take very long. I mean, the discussion is up to you all, but you will have a chance to look at all of the comments ahead of time and kind of come with your ideas about what you want to do and stuff like that. But we can certainly do that if that's what you would like us to do.
So, okay, so it sounds like the group is okay with Carol, you figuring out whatever date and time that is, and then we'll do our best to be on that Zoom or call or whatever you set up for us.
Okay, and just a reminder to everyone, if we will try to do this survey, but it is going to go to your ks.gov emails. So please, please, please check your ks.gov emails because we have to send it to that. So just as a reminder, we can do a little push out that, hey, you need to check your ks.gov, but all right. Thank you for that. I just put down the meetings that I attended. I did go to the annual meeting. It was done virtually. I was one of the voting delegates from Kansas. And I do have in your, it's on page 40 with my thing, I do have the press release from National Council. But the great news is that our Adrian was reelected as treasurer. So congratulations to Adrian. That's great. But it did, it has the rest of kind of the synopsis of the business that was done and the other people that were elected and all of that. So I'll just kind of let you refer to that. I also have in your board packet, and we can look at it when we come to it, but the strategic plan, you directed us to get a new format for the strategic plan. So that's in there and we'll talk about it when we get to it. But just as a reminder, the strategic plan goes through June of 2022. And for those of you that were not on when we started this 3-year strategic plan, the board is the ones who decide on the priorities and a lot of that information, and then the staff kind of takes it from there. So the board's going to need to have some discussion about what are the priorities for the new strategic plan that would start in July of 2022. How this has been done in the past is there's been like a strategic retreat done by the board, and the leadership staff. And that's a time in which you can talk about what is the strategies for the agency going forward. So I don't know if there's interest in doing something like that or.
So just a little history. One of the ways that we've done that is we met at a location. I think we met in Wichita. That time is more centrally located. Like me, I'm in Garden City, and it's a long ways to Topeka, so Wichita was a little closer. But we could get there away from Topeka, and we spent a day or day and a half, afternoon and a morning, so we could all get back to our spots. Stayed one night, but we're able to get through some of the concerns that we had and help direct or put a plan in place to help direct the agency where we might go in the next 3 years. So Carol and I have visited a little bit about this, in that maybe we try to find a spot that we could do that, depending on the numbers of course for COVID or whatever. This session, we've always done it face-to-face, but it probably needs to be face-to-face if we can do that at all, whether we social distance and whatever it is, but be in the same room discussing that back and forth. It's just a little easier than it is on the Zoom. And we usually have a presenter that helps facilitate and bring us through those processes. We have somebody in mind for that. We've already asked about his availability. Great person. He was with National Council. Would really be a great inspiration to everybody. He's worked on a board. He was, his credentialing was actually board, the agency head. So any discussion with the group, can we give Carol and the team permission to see if they can find a venue? It would probably be in the spring. I don't know when, February maybe. It's not absolutely, I'm sorry? I'm not absolutely sure. I mean, it's not mandated, but it certainly would help if, once again, we could find a time that would work for everybody. It's going to depend on what is open in the venue that we can find big enough for all of us to meet. Anything else, Carol?
No, that's about it.
So if the group's okay, just by the nod of head, we can figure out some kind of date, what might work. I promised you that it will be worth your time to make that happen if you can be there, because we can kind of see each other across the table and get to know each other a little better. So it's a great time. It's work though. We don't get to just eat snacks, although they have plenty of that. But anyway, so unless I hear an opposition, we'll let Carol and the team work on something and see what we can come up with to see if we can help with another plan for another 3 years. If that's okay. Okay, Carol, thanks for that.
All right, thank you very much. We will work on that. And then just updates there. I always put everybody's terms down here just so that you're aware of who's coming on, who's getting ready to leave, stuff like that. Just as a reminder on your committee assignments that would start in December, those will be done by the new president and vice president that you elect today. Jill and I will work with them to set up a Zoom and get this done, hopefully maybe within a couple of weeks after today. And then we will get them out to you so that you know what your new committee assignments are. We really appreciate everyone giving us your preferences. That's very helpful. So just kind of stay tuned. Again, that communication will be sent to your ks.gov emails. So, okay. I think the only other thing that I have is just on projects. I will be starting on the U.S. Department of Education renewal application next week. That has to be submitted by February. And what that is we are one of 4 boards of nursing in the nation that are approved to accredit nursing programs through the U.S. Department of Education. This was actually started before I came to the board, and then I did it a couple of times in education, and I've worked on it a couple of times then in this position. It's a little bit of work, but it's a great recognition to be one of 4 boards of nursing in the nation to do this. So I will be working on that. hopefully that will be pretty well done by the December meeting. So I think that's all I have. If there's any questions for me.
Any questions from the group? If not, we'll go to Chelsea. That's the next person I have on my list. So would you like to give your report, Chelsea?
Sure. Good morning. My name is Chelsea Stevenson. I am the education specialist here at the Board of Nursing. I came on board in February of 2019. I actually started as the education department assistant. And then I guess I was like Carol and looking for some challenges. And so I stepped into this role in the middle of a pandemic while working remotely in the fall of 2020. So I have a background in education as well. I'm actually a student virtually at Fort Hays. I'm working on some furthering education degrees. And then prior to that, I did have some years of experience working on the clinical side here in Topeka at Stormont Vale. So that's just a little bit about me. My education specialist report is in your packets. I oversee the CNE and IV therapy committees here as a staff person. You will see in my report, I just give an overview, excuse me, of our providers, our CNE providers. I did have one new provider that was approved by the board in June. We had 4 voluntary relinquishments of providers. Those are listed in your report as well. And then we had 2 single offering CNE providers that were approved in the last quarter. We did not have any IV therapy providers apply. There is a brief overview of the 2021 CNE and IV therapy annual reports. Our providers are required to submit those reports by July 31st of each year. Of the 100 long-term CNE providers that we have, 91 of them submitted their annual report covering data from July 1st, 2020 through June 30th, 2021. I did include a copy of the summary of those reports, but I did want to mention while there were a little over 2,800 CNE opportunities offered during that time period, 21 of our providers did not offer any CNEs over the last year, and that is due mostly in part to the COVID pandemic. Same thing for the IV therapy providers. 86 courses were offered that resulted in 457 LPNs becoming IV therapy certified. 5 of our 24 providers did not offer any courses over the last year, again, due to the pandemic. I did want to touch base briefly on our delinquent CNE and IV therapy providers. On April 19th, I was directed by the board to send certified letters to our providers who had not submitted their annual reports or fees for 2020. They were asked to submit those delinquent reports or fees by May 15th. We had 6 providers who did not complete their requirement of the annual report or fee being submitted. Yesterday during the CNE IV therapy committee, I was directed by the committee to begin the process and go ahead and revoke the providerships for those individual providers. And that will be something that the board addresses today as well. We are still getting rosters to our PN programs for those students that have successfully completed IV therapy. At the time of this report, there were 93 graduates who had been reported as completing their program. And we do still have 41 students pending. So they've graduated, they passed the IV therapy portion successfully. However, they've not yet been licensed through the board. So as soon as they are licensed, we do check weekly for those new graduate licensees and then add their certifications as needed. And then lastly, I just wanted to touch base on our IV therapy task force that we were directed by the board in June to create. There's a small team of us who met virtually to discuss the certification questions that an LPN sees on their testing to become certified through a standalone program. So no, not part of their PN program, but through one of our KSPN approved providers. The general consensus was that these questions were outdated and maybe not applicable to the scope of practice for an LPN. And so we discussed the possibility of creating a new test pool of questions. There's currently 100 questions that the provider is able to pull 50 questions from those 100 to create a test. So we sought approval yesterday from the committee to perhaps begin that process. I was directed by the committee to reach out to our providers to find out what they're using for their curriculum or what they're pulling their teaching information from. We want to be sure that the LPNs are learning what's going to actually be applicable to them in the field, what they'll be using, and not just memorizing data for test questions. So that's kind of where we're at now. I would be happy to answer any questions if there are any.
Thank you, Chelsea. Any questions for Chelsea at this point? Okay, let's move on. The next person I have on my list is Janelle Martin.
Hey, Janelle Martin. I'm the Nursing Education Compliance Officer. I've been in my position just a little under 3 years at this point. Prior to that, I have been a PEDS OB nurse, an educator, worked in managed care and quality and disease management, and done some traveling in that role with managed care as well. So lots of things coming into this background, and now in my role, primarily supporting the nursing education programs, amongst some other things as well. I would also just like to make a note too, as Carol did, Michelle Brown, you might see the name up on the bar, is our new education admin assistant. She just started in July, so this is her first board meeting, and we really want to welcome her aboard. Chelsea's done a great job working with her also, and Jill also has been in that position, so she's got a lot of great support, and we're just really happy to have her. But for those of you who might need to get to me and can't find me, we have Michelle to help back that up too, and is learning all about what we do, so can answer questions. So just wanted to make that note. In terms of the education and the nursing programs, you have my report. I won't go into everything, but I did want to make a note. We do have 4 new program administrators. We have 3 schools that had retirements or resignations, and so they have interim directors. Emporia State, Mary Mitsui is the new interim director after retirement of Linda Adams Wendling. Heston College has a new interim as well, Greg Schroeder. He's actually been with Heston for I think a little over 10 years, working with them, and is now the interim administrator for them. North Central Kansas Tech College in Hayes, Sherry Stone has taken on the role of the interim director there. She's been working in their ADN program, so has stepped into that role after retirement of Michelle Enrine. And Flint Hills Technical College, our PN program in Emporia, Kim McNeese is been announced as the new director for their program this quarter as well. And I just want to make a note while I'm saying that is I didn't put this in my report. Probably it hadn't happened yet, but we did do our program administrator meetings just Monday this week. As I think Patsy mentioned, that we try to do an orientation meeting for new administrators. And this year I invited 15 administrators to participate as interactive panelists with us, because they have been an administrator or an interim administrator for a year or less. So that's a lot of change in 1 year. We did have some other attendees, as Patsy mentioned. There are those who've been directors for a lot longer, but always welcome to come and hear what we say in the orientation. And then we also did a program administrator update in the afternoon, had lots of good support from Carol and Chelsea for those updates as well. So that was also been in process, getting ready for that this quarter. Site visits, I just wanted to make a note. In June, the board had given us permission to work with the programs. We have 9 site visits this fall, which is a handful. But we did work with them on whether those would be on-site or virtual. We only had 1 program request virtual, and that was primarily due to the fact we're doing that in conjunction with accreditation. And CCNE, as an accrediting body, is still doing their visits virtually. So we did agree to do that virtually along with them. The rest of them right now are planned to be on-site, and we hope to continue that. I believe it will come to the board today for a final look at that. Just a mention, I review CGF and S reports, and those are for our internationally educated nurses. And both Ray and I, Ray, who's the supervisor for licensing, have noticed quite an uptick in the number that we're seeing. I think the pandemic and the shortage and there's been a lot of work to work with internationally educated and get them working. And Kansas, I think, has seen a fair number of those. So I just wanted to mention that because when something like that happens, I think it's worth a note. In terms of FQRs, I think COVID is continuing to have some effect there. 64 new FQRs, well, there were 34 of those were initial requests. What I'm seeing primarily is an uptick in the number of adjunct faculty requested. We have had a lot of programs tell us in listening to them, many facilities are decreasing the number of students that are being allowed. So they're seeing a need to either find more, to decrease the number per group. And so they're needing more adjunct faculty. And just like a lot of the facilities are experiencing, there tends to be a shortage of folks when they're needed in the clinical facilities. So they're struggling a little bit to find the qualified faculty. So lots of higher exceptions and degree plans that we're seeing, but are encouraged by the number that we are seeing go to degree plans and hopefully will continue in education. One of the biggest efforts, I think, for this quarter has been the annual report, which Education Committee looked at yesterday. This was the first year that we did our annual report in conjunction with NCSBN and the core data report that they have put together and that you all voted to work with for starting this year. So the core data report that they do, they have put together that report for all of our Kansas programs. All 58 of our undergraduate programs and 10 graduate programs did submit their annual reports. Only the undergraduate report will be part of the core data. That was what it was designed for. So all of the graduate program data I put together in a kind of a supplemental report that goes with the NCSBN report that they have provided. One of the things that we are anticipating and waiting for and hope to have in December for you is one of the things that we felt was valuable about this effort and working with NCSBN is they're going to be providing us with a comparative report. I think there were they had 11 states that were part of the pilot year for this core data report. And they may have had one drop off. I can't remember for sure if they were able to keep them on board, but they were getting final data from a couple of states. And so we hope to have that comparative report then. We won't have it here in September, but hope to have that for December. And really hoping to see how Kansas looks with our undergraduate and the core data that they have as part of the looking at program guidelines. That core data really refers to those things that they found after the years of study that they did in the report that came out. In looking at program approvals, there are certain factors that they see tend to make a program work really well, and then also some warning signs. So the core data then are the questions that get to those things that they have found to be either good things or possibly warning signs. So I think in looking at that and asking questions from that capacity, and they fit very well with a lot of the questions that we were already doing. So we did add some additional questions to our annual report, which I did the comparison and did a supplemental report based on that data that we need to have because of either our regulations or the U.S. Department of Education regulations that we follow. But I think it went very smoothly, had very few glitches. We had a few, but our administrators worked well with us and with NCSBN, provided a point person, and that went very smoothly. They were very responsive to us and getting the report, some changes done. We had a few final changes that didn't get into the copy that's in your packet. We will have a couple of changes, but it wasn't substantive in terms of the outcomes. So I didn't feel like we needed to put in the updated one in a board on-site packet. So I think with that, the one last thing I might say is on my third page of my report on page 10, it does refer to the CADNY Fall Forum, which is going to be in Salina. And I said that with the registration date of October 15th, but I failed to put that the meeting is actually October 28th and 29th. So I just wanted to mention that as well. And with that, unless there are questions, I will consider that the end of my report.
Thanks, Janelle. I think any questions for Janelle? Okay, I think we'll move right into Linda's report. And then we're going to be really close to our presentation time. So we'll go ahead and let Linda do that.
Thank you, Madam President and members of the board. Welcome to the new board members. Glad to have you. I've been a nurse for 17 years, med-surg, OB, ICU, and public health. I came to KSBN in 2018 as the education specialist. I was the pre-Chelsea. She's now improved upon that position. And I also, like Carol and Chelsea, sought new challenges and moved to the investigative division in September of 2019. So this is tomorrow is actually my 2-year mark as the practice specialist. That title is a little daunting as I continue to learn daily. In nursing, I don't know if you're ever a specialist of anything. Prior to becoming a nurse, I was a paralegal. So as I mentioned in board orientation recently, I am a data nerd and I like seeing how facts generate discussion for process improvement. So that's a little bit about me. In your packet, you have my report, and I will just bring to your attention a few items on it. The data listed on the report is for the quarter of April 1st to June 30th. And in the investigative cases that we opened, the significant investigation cases relating to impairment of number 76, the previous quarter, we opened 20 cases for impairment. So that's a bit of a jump for the quarter. I'm still monitoring to kind of see the trends, and I will report on that accordingly. You see our case status and our complaint sources. We've been gathering data electronically for the last 1.5 years or so, and it's allowing us now to report on items relating to case investigations. So one of the data points that we collect is the time frame between when the incident occurred at the facility and the date the facility actually reported it to KSBN. So on average, we found for risk managers report an incident within 120 days of when it occurred. Family or a patient will report within 170 days after it occurred. And the other category includes other regulatory agencies, the Office of Inspector General, Office of Attorney General, insurance companies, travel agencies, and there is wide variation in reporting, anything from 106 to 503 days after the incident occurred. Another data collection point is how long a certain type of violation took to be reported to KSBN. Impairment with drugs and alcohol, which obviously is of concern, which includes diversion, on average took 21 days to be reported. Abuse averages 34 days. Violating patient confidentiality, average time frame to report to the Board of Nursing is 96.6 days. We are also monitoring applications with legal history, and I've reviewed 585 applications in the quarter. The licensing application is forwarded to the investigative division for review when the applicant answers yes on the license application to any legal history and/or the background report indicates legal history. The question was changed to be legal history within the last 2 years, and sometimes we have them still answering for all legal history, and that prompts a phone call to remind them to read the question correctly. We have streamlined how we present cases now resulting from applications so that they mirror how we present cases resulting from complaints to the investigative committee. For open records requests completed during the quarter, we did 18. They still come in, and we still get those processed as timely as we can. For supervisory issues, their first 2 bullets, I want to take a few minutes and discuss these and explain an issue that we found when we were gathering end of year data and how we looked at that data and then did some collective efforts to improve on our process. It had to do with a review of complaints within 2 weeks of receipt. And the data led us to do the following. First, it identified challenges and barriers that potentially prevented us from meeting that goal. Second, it provided us an opportunity to understand the what, the how, and the why we are doing a process a certain way. And finally, it provided a means for us to be able to reach out to other state boards of nursing and ask, is there a better process, a better evidence-based metric that we could employ? As Carol mentioned, the challenges for the agency sometimes is, we are not all electronic, and that is certainly true for the investigative division. Everything was paper when I started in September of 2019. And in March of 2020, we went hybrid and remote and tried to move everything in a paper format to electronic as fast as possible so that we could then have safety and security of staff members. That was the priority at that time. So to do that, to move in that capacity required us to then scan all the mail that came in. And in scanning the mail, it wasn't just scanning a complaint, but sometimes the complaint and the documents that came with it, and then doing a quality review to make sure that the scanned document equated to what we received in the paper format. Sometimes the scanners would, get jammed and shuffle pages and miss a page. So, and sometimes the submitter would send in a document that had a sticky note attached to it. Well, if that's not caught, that'll get jammed into the scanner, and it's just, it made for errors. So to move to full electronic processing, we are still working on that, but we've uncovered in the last year and a half infrastructure issues such as storage, security, even financial issues that we needed to identify and address. So basically, a lot of behind the scenes events have needed to occur first so that we are able to then move electronic. It's a slow process coupled by the pandemic response, but we are patiently waiting for full electronic capabilities. And so I look forward to that eventually. The process for professional review of a complaint then changed when the response to the pandemic required us to work remote 7 months after I started on the investigative side. Moving to electronic and remote options, the paper complaints we received via mail, we logged, we scanned, we quality checked, we linked to a checklist, we placed in an electronic folder and routed for professional review. And sometimes we were losing 4 to 5 days just in that due to preparation of the complaint for a professional review to occur. So some changes that we made. Complaints are not held to be scanned and logged, rather they are processed as soon as they are received. And then the review of complaints changed for the first review, changed to only include the notation of 2 things. Does the Board of Nursing have jurisdiction over the licensee? And is the allegation on the complaint a violation of the Nurse Practice Act? The second review then is more in depth, is to understand the prioritization of complaints, significance of allegations, previous history of the licensee, licensure in other states, because we're now members of the compact, compliance and enrollment in ATD programs, the impairment provider programs, et cetera. That takes a little bit more in order to be able to assess where do we and how do we assign this complaint to be opened for case investigation. These changes were implemented on July 1st, and since that time frame, we have a compliance rate of 83.9% of being able to review the complaints within a 2-week window. So much better, but yet we still have room for improvement. We also then surveyed other state boards of nursing about their time frame for reviewing complaints. And the survey results from 26 of 50 states responded, which according to NCSBN, the National Council for State Boards of Nursing, is about average for responses, but 66% of states do not have a specific time period to review complaints. 34% said that they did have a specified time frame, but in further questioning, it varied from within 24 hours of receipt of complaint, within 1 week, within 2 weeks, within 1 month. So not a lot of consistency. So then I asked a question if any other state was aware of any evidence-based guideline that existed to identify the time frame for review, and 90% of them said no. So I feel pretty good about how we identified a problem and came up with a solution to change our process and strive to meet a goal. And we continue to evaluate and improve upon this process. And I appreciated Carol's input throughout this entire time, as it was a little frustrating to figure out why we and what we could do and how we could do it. So you'll see current openings for RN investigator. We have 3 openings. One I'm holding open for budget reasons, and the other 2 we interview on an ongoing basis. We did lose an investigator in June who was enticed to return to the private sector. It affects our processing times, as caseload for each investigator is enormous. and complaints still come in the door. We were part of the preparation for the reinstatement applications that we anticipated coming in after the expiration of the executive order on August 28th. And Carol directed that we develop a plan to address those applications timely so that nurses could return to their employment and employers would not be without licensed nursing staff, especially during these times. If a nurse works unlicensed, that is a violation of the Nurse Practice Act, and it is investigated. So our plan is we meet weekly with the investigative committee chair and we review any applications that are ready to be reviewed. We monitor the volume of applications received. And if we need to add further days to meet with the investigative committee chair, then that can be arranged. So she's open to meeting more than once a week so that we can process applications timely from our end. For practice calls, the COVID, we've had 179 calls. We currently average 5 per week. This number is only since the spring of 2021 when we began logging the number of calls that we were receiving reflective of practice relating to COVID and what do I do. Yesterday during practice committee, I asked for educational resources for evidence-based practice that can be utilized to help address practice inquiries that we receive. We still receive a ton of different ones on school nursing, telehealth, med spas, everything. I was directed to do a survey of other state boards of nursing to see how they address practice related questions and then to bring that back in December to the practice committee. I put on here KU, the Area Health Education Center, is putting together a webinar series that will focus on employee mental health to be available this fall. First, I want to make mention that KSBN is not endorsing this webinar series, but only notes that it is a timely topic. KU AHEC notified KSBN of their webinar series, and we understand that nurses are working on the front lines throughout this pandemic and that this webinar will hopefully be enlightening and helpful to the nurses in Kansas. There are some various meetings that we attended, mostly virtual, and trainings that occurred as well. KDHE reached out to KSBN to discuss nurses' scope in response to COVID. This was basically an informational type meeting about vaccination, testing, orders, location. I look for continued discussion as we are in new territory with responding to the pandemic. That is all I have for now. And I think I barely reached the 10:30, but thank you and I stand for questions.
You did great, Linda. Thanks for that. Any questions for Linda? Okay, hearing none, I think we'll go ahead and go to our presenter. And after that, right after he's finished, we'll talk about our agenda timeline and set up a break in there. So hang on for just a little bit and then we'll continue with that. So I see Colton working frantically getting that hooked up. So we'll wait just a second.
Madam President.
Sure.
This is Carol. And I just wanted to maybe just kind of introduce this topic. Just
sure.
A tad bit.
Great.
Thank you. Actually, CE Broker, I'm going to let Dawn, who's going to be coming on here, explain it a little bit more. But the reason that I requested that we get more information for the board is there's a lot of opportunities with CE Broker, you know, for the licensees, for the CE providers, also for our agency, and you're going to hear all about that. But, you know, I thought the first step would be to let all of the board hear about it, and he'll do a great job telling you about it. But then just see if you wanted to have any discussion or anything about the possibility of this. So it looks like Don's on now. So Don is actually with CE Broker, so he's going to do a great presentation here to tell you all about it. He's done it for Chelsea and I, and Linda's actually been part of it too. So thank you, Don, for coming today. We appreciate that.
Yeah, no problem. And good morning, everyone. And Carol, thank you so much for giving a quick introduction. So like Carol mentioned, I have a quick presentation that I'm going to run through that'll just give kind of a brief overview of CE Broker and explain how we've helped other nursing boards in the space. And then afterwards, I figured I could open it up for any questions that you all might have. Let me go ahead and put this full screen and just let me know, can everyone see the CE Broker slide okay? All right, fantastic. So to give everyone a brief summary, CE Broker is really just a unique software company that partners with licensing agencies or regulatory boards to really simplify and automate the process of continuing education. And our biggest selling point has always been that we're able to accomplish that without enforcing any mandatory cost or burden on the primary stakeholders. And we view those stakeholders as the educational providers or course instructors, the licensed professionals or the nurses themselves, and then the regulatory boards or the state agencies. We also think that just about everyone can agree that CE compliance, or at least the audits and enforcements or enforcement process, is notoriously a headache, both for licensees and for state regulators to manage. So we do what we can to simplify that process wherever possible and make it more efficient for both parties to deal with. We think the software platform model has become very prominent in the world today, and we always like to point to industry leaders like Amazon or Airbnb that have really changed the way we live and do business. But personally, we feel that the regulatory world has been somewhat left behind by modern technology, and especially in the realm of continuing education. So it's been our goal to change that state by state. And on the screen here, you can see a helpful graphic that really breaks down how CE Broker works and kind of explains where the data is flowing. So as you can see, information comes in from licensees, from CE providers or course instructors, and from state boards, and all of that's aggregated onto one platform and broken down by a comprehensive compliance engine that we customize to each state. So there's no one size fits all with CE Broker. We actually tailor the system for each individual licensing board and jurisdiction. As far as our history goes, we were actually founded back in 2003 and started off tracking for Florida's Department of Health, which of course did include their Board of Nursing as well. And that's where we were essentially born into the realm of continuing education. And our platform was built in response to an RFP that they put out for a CE management system. Basically, the department needed a CE system, but didn't have $1 million lying around to sink into building one themselves. So they asked vendors to come up with a creative transactional or freemium model that would allow the state to implement this sort of technology, but without a large upfront cost. So that's kind of where CE Broker's unique subscription model came about. And it wasn't until maybe the last 5 or 6 years that we really started looking outside of Florida and recognized that they weren't the only ones dealing with issues managing their continuing education programs. So since then, we've grown exponentially. We've now expanded to track for more than 130 different boards across the US, and we have a presence in 21 different states today. And among that population, we support a network of more than 7,000 educational providers who are listing courses on our platform, and they can actually report the attendance rosters and completion data directly into our system. So this basically means that, if Jane Doe takes a CE course from nursingce.com, that provider can actually report that completion into CE Broker. So the next time Jane logs into our system, she'll see the 3 hours in ethics or whichever course she completed, and the state can actually see that it was verified by the course instructor or the CE provider. Beyond that, we also have experience tracking for more than 200 different profession types. So needless to say, if the profession has some type of CE component or a competency requirement, it's more than likely something that we've dealt with in the past or that we're tracking for in another state. And on the map here, you can just see a visual of our growth over the last couple of years. We are still largely concentrated down in the Southeast, but the most important thing to note here is that our current partnerships are kind of an even mix between umbrella agencies. So we will have groups like Florida's Department of Health or South Carolina's Department of Labor, Licensing and Regulation. So a lot of those darker shades, it's more of a statewide deal where we're tracking for every profession from nursing to dentistry and medicine. But whether it's an entire department or just an independent board, the solution does scale very well. So we've handled a little bit of everything up to this point. Then obviously in today's day and age, privacy and security are paramount for any organization. So our platform is compliant with Federal Information Processing Standards or FIPS. We're also DSS compliant, and we have geo-redundant data servers in Jacksonville, Florida and Louisville, Colorado that just help us ensure stability and high uptime for our clients. But aside from this, the main way that we protect ourselves as a vendor is just by avoiding any personal or sensitive data. So anytime CE Broker contracts with a new board, the majority of the information that we collect is already public facing on the license verification pages for consumers. So this would include things like an individual's name, their license number, the issue date of their license, and the expiration date of their license. But in other words, if the information doesn't affect their CE requirements, we don't require it for tracking. So an example that I always like to point to would be things like birth date, because in some states like Ohio, we have a handful of boards where an individual's birth date actually influences when they renew their license or when their CE is due and when everything expires. So that would be an example of a case where we would need an individual's birth date. But outside of that, we don't collect or require that information. So we try to operate as lean as possible and never collect anything like social security numbers or any private data beyond just simple contact information. And really a primary benefit to the platform we've developed is that each of the three main stakeholders I mentioned earlier all receive their own unique login, which allows them to come on and complete their own piece of the puzzle. So whether you're an educational provider just signing on to submit an application and get a course approved, or maybe report a completion on behalf of a licensee, or if you're just signing in as a nurse to get a quick overview of your CE requirements and report a class that you've just taken, you're able to log into CE Broker for free and handle your half of the equation without any paperwork required. With that, I'd like to actually hop over and give you guys a quick preview of how the platform looks for each of those main stakeholders. So one really key aspect of CE Broker's platform is the course search. So this is where nurses would be going to find approved or accredited education content. So we essentially build out a catalog based on the state's requirements. Right now I have it set for a registered nurse in the state of Florida, but all of these courses you'll find have either been directly approved by the Florida Board of Nursing, or they satisfy requirements that Florida has said that they'll accept, things like ANCC accreditation. But basically, we create this sandbox environment, so to speak, for licensees. So you never have that situation where you go and find a course on the course search, and for some reason it doesn't actually satisfy your state requirements, or it won't count towards your renewal. So we vet all of these courses and ensure that licensees have a very easy place that they can come to, basically almost like an Amazon marketplace for continuing education, where they can compare courses, read reviews, find a best price for the hours that they need. There's a lot of different ways you can filter our course search. So if you're looking for a specific subject area like medical errors or a new topic that the board has maybe just introduced that's going to be required next year, you can filter the course search through a variety of different categories. You can find in-person CE or online distance learning. You can filter by price. But of course, the goal here is just to make it as convenient as possible for individuals to find approved education content. An important footnote here as well is that CE Broker doesn't create any CE content or courses whatsoever. So we leave that entirely up to the board's approved third-party or accredited educational providers. But otherwise, this is just a really helpful tool for the licensees to quickly find CE and obviously satisfy their renewal requirements as quickly and efficiently as possible. Otherwise, this is a quick glimpse at the perspective for agency staff members. The big thing that we try to provide to boards is an immediate glimpse or real-time statistics into the licensee population. So if the board wanted to discuss at one of their meetings how many of our licensees are currently compliant with CE versus not compliant, versus how many individuals are perhaps meeting a new ethics requirement, we can provide that information right at your fingertips. So whether it's used for board discussion or for the enforcement department at the agency, that information is immediately available to staff, and it kind of empowers them with a paperless platform to manage CE compliance. Additionally, I wanted to show you a quick glimpse of the educational provider suite. So this is an important piece of the puzzle because, like I mentioned earlier, the CE providers can actually report a completion on behalf of a nurse. So we try to alleviate the burden on the individual nurse's shoulders to self-report their CE. So a lot of times when you take a course from a certain provider, they'll report it for you. And you'll even notice on our course search, a lot of providers advertise, hey, I'll report to CE Broker for you. Sometimes you'll see these little badges in the corner of their course that says that they report within 24 hours. This just lets the nurse know if you take that course from that provider, they'll report it into CE Broker. Your state will have access to those records. You don't have to worry about everything. It's all taken care of for you. But otherwise, providers have access to submit applications directly through CE Broker. So for boards that do individual course approvals or provider approvals, they can actually collect those applications directly through CE Broker and save some paperwork. This isn't something that's required, but it's just something that we offer. So whether the board already has a system to manage course approvals, or if they prefer CE Broker's system, this is of course available at no cost. And then, like I mentioned, the providers have a way right here to actually upload an attendance roster, or they can report one by one for any licensees that have completed a course from them. So we try to make it very easy for the CE providers to report completions, save the nurses time, and gives the state verified data. And then finally, I wanted to switch over and give you all a quick preview of the licensee account. So if you're signing in as a nurse, this is how the platform would appear. My test account here is an occupational therapist in the state of Florida, but the way the account looks and feels is pretty much identical, regardless of what your profession type is. You have your license number at the top. You can see your cycle dates. At the bottom, you have access to your course history. So you'd be able to see anything that you've reported yourself, along with anything that's been reported by an educational provider. We also give licensees a way to rate those courses. So when you're shopping around on the course search and you want to make for sure that a certain course is actually, worth the dollar that's being charged, you can read some reviews from other nurses and verify whether or not you think it sounds like a good course based on your specific needs or your specialty area. And then, of course, the compliance transcript is going to be one of the most helpful aspects of CE Broker. That's just going to break down, how many hours are required for your license type, how many hours you've already reported, and how many hours you still need. And it's going to be broken down by any subject areas that the board requires. So in Florida, they have a medical errors requirement. We can see that this individual has satisfied that requirement. They still need 5 hours left for their general requirement. And CE Broker is even telling them, hey, we found 8,000 courses that'll fulfill this requirement. And you can click that button and it'll take you right over to our course search and start showing you approved courses that would meet that requirement. And then they still needed their 2 hours for laws and rules of the board. And we can also put helpful information within these accounts for certain areas that are sometimes confusing for licensees. In the state of Florida, they told us that, a lot of licensees get confused about what counts as home study. And people frequently report the wrong things for that category or call in about it. So we included information inside the account that just lets the licensee know you can't take more than 12 hours of home study, and it gives them a quick explanation of what actually counts for that requirement. But again, everything's broken down very simply by how many hours that you still need, what was required for your license type, and then the reporting process as well is pretty straightforward. We also work with a lot of boards where continuing education or traditional online CE isn't the only method of demonstrating compliance. We recognize there's a lot of different other activities that sometimes count, like being an editor of a book related to your practice, or a lecturer of a course or program that might technically count as CE credit for your upcoming renewal. So we can program the system to basically collect any documentation that the licensee would usually submit to the board to prove that they completed that activity, and it does actually count for their CE credit. So even if it's not a traditional CE course, we can, again, collect that documentation, give the licensee a way to report it, and make sure that they're able to demonstrate compliance to the board quickly and efficiently as possible. And then finally, I just wanted to hop back to our slide deck here and give you all a quick overview of the funding model behind CE Broker. So one of the most unique aspects of our platform is that there's not actually a cost or fee to the board for using CE Broker. So again, back with our history with Florida, they needed a vendor to build out a CE system, and they needed someone to come up with a creative transactional model. So this is kind of the funding model behind CE Broker. Basically, we have 3 different account types that allow us to generate revenue based on voluntary subscriptions. About 80 to 85% of our licensees just use our free basic account, and that'll let you report your CE. You get helpful renewal notifications. You can use our course search. It's your official record storage. You can track multiple licenses. Basically, everything that you need to demonstrate compliance is available within our free account. And then beyond that, we offer above and beyond services in our professional and concierge account, like an individualized transcript that can automate the reporting process for you, even remind you of a specific course that's missing, or a personal account manager who can actually register you for CE courses and events, and basically is personally responsible for making sure that you reach compliance and can even respond to an audit on your behalf. So that's the main funding model behind CE Broker. Each individual can choose what account type that they have. And out of the 2 million licensees that use CE Broker today, like I mentioned, about 80 to 85% use our basic account, with the 15% usually being split between either the professional or the concierge account. And it usually does kind of vary on demographic. Usually the more complicated their CE requirements are, the more likely an individual might be to subscribe, because it can actually save them some time. And with that, I did want to pause for a moment here and open it up for any questions. I understand that we did have kind of a limited amount of time today.
Any questions about the presentation? Go ahead, Carol.
No, I was just going to ask if anybody had any questions. I didn't know if you were waiting on me or what.
I have a couple questions. So this would work only for the licensee who is utilizing it. In other words, the state boards can't mandate or force the licensee to use this system. And I'm sure they would choose the free, the FRE, no money option, but we can't require that, can we, for them to use it?
So just to speak from our experience, right now there's about 10 different state nursing boards using CE Broker today, and they each kind of approach that in a variety of ways. Florida right now is one of the few states that's completely mandated CE Broker for all licensed profession types, but the way they do that is kind of a little bit creative. They don't mandate that licensees use CE Broker. They basically say, you have to report your continuing education into our tracking system. Right now, the vendor for our official tracking system is CE Broker, but the state's kind of protected. So in the future, if a different vendor was to provide that service, they don't have to change their legislation. They basically just have a rule that states that licensees have to always report to their digital system so that they're not having to manage paper. Other ways that states have managed it would be Kentucky's Board of Nursing is an example that I like to point to because they don't mandate that all licensees have to use CE Broker. Instead, they basically told their licensees that if you're selected for audit, this is going to be our official platform to manage the audit. So you can't mail or fax in your paperwork. You just have to upload it to CE Broker. You can do it for free, but this is going to be the platform that we're using to check on your CE requirements. So that was how they kind of rolled it out. Otherwise, you're not required to use the system unless you come up in the audit. But again, each state kind of approaches it a little bit different. So we're very flexible on this end.
And one more question. Does the board have access to that?
Yes, absolutely.
Okay.
Yeah, so it's actually the board staff at the end of the day that can still go into CE Broker and check on the status of an individual nurse, make sure that they've met all their CE requirements. So staff have complete access.
Okay, thank you.
Any other questions?
I do have a question as well.
Go ahead, Jay.
So regarding some of our long-term CNE providers, would they be coming into the system and just including some of the classes that they, have approved for credit, and then individuals, licensed nurses that are going into CE Broker, they could search for different classes that might have CNE available and then choose from some of those long-term provider courses?
Yeah, that's correct. So the providers of the courses can register in CE Broker for free, and they can put their courses on our platform. But the great part is, even if a certain provider never put their course on CE Broker, as an individual or as a nurse, you can still report that. As long as they gave you a certificate after you finished completing the course, you can upload that to CE Broker for free, and it's going to be stored there permanently. So the board has access to that. And I think the really rewarding thing about CE Broker is for the individuals who are kind of proactive about their CE, if you already reported everything before your renewal deadline, a lot of times when you get selected for audit, there's not actually any further action required on your behalf. The board can sign in, view that you've already uploaded everything. They can check on your records, and you don't have to mail or fax any additional documentation. So it kind of gives you peace of mind if you've already met all of your requirements.
Thank you. Very well. And you made mention at some point that those providers could also upload their rosters to kind of help streamline this process for the licensee?
Yes, that's correct. So even if they are holding a big class with 30 attendees, 50 attendees, they can actually drag and drop the attendance sheet directly into CE Broker. As long as they took down the names and the license numbers, we can make sure that every attendee for that class gets credit. So the next time they log into CE Broker, they would see those hours reported by that provider.
Thank you for that.
No problem. Thank you.
This is Adria Goldsmith, board member. How long does it take to set this up for a particular state where it can be utilized?
That's a great question. So it's typically between 90 to 120 days from having the contract signed to actually getting the system live and ready for the licensees. So usually around a 3 to 4 month period to have it ready for the licensees.
Any other questions for the group?
I have one more, mate. I think I'm understanding this. Would a licensee be able to complete an assigned CNE if it's above their state's required number? amount?
That's correct. That's a great point. So that there's two scenarios where that kind of comes up within CE broker. So say you have two RNs, same license type, same cycle dates. In cases where an individual maybe has a disciplinary action on their license and maybe they need 2 extra hours, that can be tracked within CE broker as well. And then also for the overachievers that are earning more CE than is required, that can all be stored and tracked within CE broker. And we can basically calculate based on the board's rules. In some states, the extra hours carry over to your next cycle. Of course, if that's not the case in Kansas, we would just provide that information in the licensee's account. You can earn more than these 32 hours or whatever amount is required, but it's not going to count for next year. So we can make sure that it's pretty obvious and clear to the license holders.
Thank you.
I have a quick question. This is Andrea Watson. Is there a way that licensees can, if they do upload and maintain their CEs through your site, that they can make, a listing or, I guess, give you access to another organization? Let's say they hold other certifications, so they use this as their, CE site. Can they print a list of their CEs? Is there ways that this would work with other organizations?
Absolutely. That was a feature that we actually added in the last year based on popular demand, just because a lot of folks that are registered in CE broker today maybe had a license in another state that wasn't using our platform. So we did add an export transcript function. So just like downloading a transcript from a university website, you can actually download your CE broker transcript. And if you want to email that to another board or to your certifying board, you can do that pretty easily. So you kind of have access to all your records at your fingertips, and you can download them, export them, or send them to other organizations as you wish.
Thank you.
Some great questions. Anyone else?
This is Carol Moreland. And Dawn, can you kind of speak to the point? I asked Dawn this question, if we decided to do this, the communication is going to be so important to get out to 70,000 licensees about this. And sometimes that's a challenge for us. And so Dawn did share that they have someone that would be able to work with us. I don't know, Dawn, if you want to just speak to that momentarily.
Absolutely. So we do have a full communications team at CE Broker that can create content for board newsletters, for email announcements, and help the board put basically like a snippet on their website that lets licensees know, here's how you can claim your free CE Broker account. These are the tools that are available. We can create content that informs them whether or not it's required or if it's just voluntary. On the screen here, I just pulled up a sample of announcement that we made for Kentucky's Board of Nursing, but we can draft this material and basically similar material for each board. We did one for West Virginia as well, that just lets the licensees know, what CE Broker is, how it works, and where they can go to claim their accounts. So our staff in our communications department kind of acts as additional staff for the board. So we don't expect the board to have to draft or write everything up themselves. They just tell us what they need and we'll produce it for them.
Any other questions? Not hearing any. Thank you, Dawn, for your presentation. I think what we'll do here, if it's okay with the group, is we'll take a 15-minute break and come back. We can discuss where we want to go with this particular issue from there. And then we can let Dawn know what we want to proceed with. And then we'll finish the staff reports and move on with the agenda. So 15 minutes. So
Absolutely.
I guess.
Thank you all so much for your time.
You're welcome. So 11:15 we'll reconvene. Thank you. It's 11:15, so we'll reconvene. I do see a note from Lori, and that she's reaching out to Colton to get her hooked back up again. I guess she's having some more trouble. Okay. So Colton, are we ready to start?
Yes, you're good to go.
Okay, thank you. Okay, let's reconvene the meeting. And I think I want to start with first, and with the presentation that we just saw. One of the questions is are we interested in this enough to, my suggestion would be to maybe ask the agency to pursue this and bring some more information back to the December meeting, like some timelines and some details about how we would do that. Are we interested enough to follow up with some more details? We really don't have to have a motion. Carol, you want some input there?
Yeah, I just wanted to remind everybody that there's several things that we would have to check out here. We have to talk to our legal counsel to see if there's any concerns from theirs. You know, we will have to check out and see if it has to go through procurement, contracts. We have to talk to OITS, some of the security stuff. So there's several things that we still have to check out, but you know, we just weren't sure if you were interested in us checking any further, or I just wanted you to know about it and see what you thought about it and stuff like that.
I kind of was remiss in letting you talk a little bit, Carol, why we even started down this trail with the CEUs. You talked a little bit about it, but the struggle that we have is with renewals and making sure that their compliance with the regulations that we have around that licensure. Is that correct?
Yeah, that's part of the issue. You know, there's just still some confusion among the licensees about CE requirements. And then it has to be at their level. And so the APRNs sometimes get confused about, well, what would actually be approved for APRNs. You know, they can do a search in CE Broker and it will only come up with CEs that are approved for APRNs. So that should help some of that. You know, it would really help us with audits because again, as Don said, we can just, you know, if we could tell them, you know, that CE Broker is how they have to submit it if they get audited, then it's much easier for someone from the agency just to go in and view it versus waiting for something to be mailed in or faxed in or emailed in or whatever be the case. Less paper coming into our agency if we can verify it through CE Broker. So I just think there's several things that could be beneficial here.
So unless we have some opposition from the group, I mean, is everybody okay with giving them permission to look into this and see what we can do? No opposition? Andrea?
I just have a quick question. No opposition, but is everything that we do now, like, I mean, do all licensees have to have electronic access? I don't want to create a barrier, I guess, for someone who may be audited if they would, you know, not be able to upload their CEs, or this would cause a problem. I mean, I know our newsletter now is electronic, and is the only license application or renewal online? I guess I just want to make sure we're not excluding anyone by this.
Yeah, that's a great point. This is Carol. And by and large, the majority of applications, I don't know the percentage off the top of my head, do come in and are done online because it's the fastest way. But we do receive paper applications. And there are paper applications on our website if they choose to do that, because we do have some people who will tell you, I don't have access to a computer and I don't want to go to a public place and put some confidential information in or something like that. So I certainly understand that. Yeah.
Well, as long as I'm not hearing any opposition, I think if the group's okay, we'll let them go ahead and collect some information, bring it back in December, and then maybe we can make a decision or take the next step, whichever that might be. But at least check it out.
Madam
Sure.
President, if I might add a little comment, Adrian Guerrero, Director of Operations at the board. Historically, we're averaging about 90% online. Since 2001 is when we went live with our online licensing renewals, and as kind of a little bit of the history, we used to try to track some of this information and get it provided to us via the system that we were using at the time. However, it was complicated to administer, and some of the struggles that the CE broker has overcame by providing their solution. Essentially, we migrated to an attestation and a check afterwards. And so, having a proactive solution like this will be a little bit easier on the process. And then, essentially we don't have to build the solution within our current system, which has an expense and that sort of thing associated with it. So, but definitely the trend nationwide, there's a report that's posted by the National Council of State Boards of Nursing called the CORE Report, or it's the Continuing Ongoing Regulatory Excellence report, shows that the trend is definitely moving towards requiring online processing for almost all applications throughout the United States. But Kansas does still have the option to download the form currently.
Madam President, this is Chelsea with the board staff. May I offer one comment as well?
Sure.
I just wanted to address the C&E portion of the electronic submission. The board did transition to electronic individual offering approval submissions in March of 2020. We do still have the option available if they are uncomfortable with electronic submissions of that information to send them a paper application for the C&E approval. I was just looking and I have not received one paper IOA form in several months. So I would say we are probably close to a 98, 99% electronic submission of the individual offering approval process at this time.
Thanks for that, Chelsea. Well, it looks like you have our blessing, at least for now. So we'll see where we go from there. So thank you for taking the time to listen to that presentation and move us forward. Always trying to stay on the cutting edge and not fall behind. That's great. So, okay, next we'll let Adrian go ahead and do his report. Now we'll finish up the staff reports.
Okay, thank you, Madam President, members of the board. Adrian Guerrero, I'm the Director of Operations here at the board. I have 21 years of service with KSBN, so I think I'm the longest serving employee currently. Been here a long time, seen a great evolution over the years, from almost 100% paper processes to now definitely moving towards 2/3 of the office, so it's totally automated. I want to thank the board for their blessing in allowing me to run for re-election as the NCSBN treasurer. I will serve another 2 years, and we're starting to pick up that process. So I'm going to be busy here over the next few months. You'll see my report that we've been really busy this quarter. We've done a lot with our back-end systems. I like to say, use the example that, when you turn on your light in your house and the light comes on, you get kind of used to it, but you don't really realize that there's a whole lot of work that goes on behind the scenes to make that happen. And that's not unlike what happens at the Board of Nursing. We have a lot of systems that you heard about, some of the processes that we're working on, and some of those systems are starting to become dated. So the reasons that they're becoming dated is because we bought them, almost a decade ago, some of them, and they're starting to reach their end-of-life status. So you naturally have to improve your infrastructure every so often. So I will say that that's one big thing that's going on right now. We're doing a lot of focus in the data center. We've moved to a new location, a more robust location, and built out infrastructure for that. And then we're also working with an offsite data center, as you heard from CE Broker. It's always critical to have essentially the production system, the backup system, so that you're always online. We're a small staff, with 26 employees. We've been pretty much the same size the entire time that I've worked for the board. But in that time, we've probably increased at least 30,000 licensees. And the reasons that we can do that is because we've become a highly automated environment. I oversee the HR department. The IT is what I was initially hired for. I work with Carol on the budget, and I oversee licensing. The manager over there, Ray Ann Bird, she does an exceptional job with her staff, and they really are the economic engine for the agency. There's 4 of them over there, and they do a fantastic job keeping the operations running. And then the IT team, I have Anthony Bluebaugh, who's working on the infrastructure side of things and does the changes and whatnot to the licensing systems and works with desktop support. And then you all have got to see Colton. He works for me as well and does a fantastic job running the Zoom meetings and doing some of our web development and user support. He's doing kind of a test project here. So when we get done with this meeting, you can go out and have a look on YouTube. We're trying to up the professionalism of the look of the meetings. And so we've created some new transitions and slides that are going in and out with our recordings. And we're going to try to get you some backgrounds for the board members so that we can have a consistent look as we have these meetings. And so I really appreciate that. He's done an excellent job. This quarter, I had to turn in the required 3-year IT plan. We have to project out essentially 3 years in advance of some of the projects that we want to do. As you heard, Janelle and Linda and Chelsea talking about their departments. A lot of those obviously have a technology component, and so we're trying to do all the best that we can to support their needs and move forward with that. And they are all doing an exceptional job planning out their departments. It's a very exciting time. This past year has been challenging, though. Actually, the past 18 months has been very challenging as we've shifted to this COVID model, trying to get some of the technology needs that we needed. Something as simple as laptops wasn't something that we had for every employee. So we worked to get some funding for that and got it through the CARES Act through the state. So that was kind of a nice thing. And we're working on getting all of those deployed to the staff members. I heard in the practice committee, I believe it was, Becky Sanders talked about how she heard some positive news about the KSBN newsletter. At a past board meeting for the new members, we've kind of shifted towards this entirely electronic process. And so we're trying to gather some statistics based upon click-through rates and that sort of thing and do some marketing. And the company, A.L. Davis, is doing a wonderful job crafting this and our newsletter and our annual report and our strategic plans you're going to hear about. They've done a fantastic job helping us with that. And so I'm excited to say that I checked with the vendor last night, and they said that we're having about a 70% individual click-through rate, which is really, really high for email marketing, but we're actually at utilization of over 100%, which means that people are coming back and looking at those articles and whatnot. So that was wonderful to hear the news that Becky shared. You always kind of wonder whether or not it's really working, and to hear her discussions was wonderful to hear. So, thank you for sharing that. And I've asked them if we could maybe start to add some of these statistics to our reports, so you can kind of see how some of that adoption's going through. Another big thing that we're working on that's been a very, very time-consuming effort, but is an incredibly important effort, is we are doing a full risk assessment and evaluation of the information security infrastructure and policies associated with those. I've kind of taken the lead as the non-cabinet agency, which is typically the smaller regulatory boards, and have been working with the state's chief information security officer, and I was successful in getting them to assign a non-cabinet agency information security officer, which is very hard to get nowadays. They're in high demand. They're paid very well, and they get moved frequently in the private sector. So to have an individual that I have helping us with it is something that is just wonderful. And so I hope to have that done soon, and we may have an executive session at a future meeting to go over some of the report to see if there's any recommendations that they're recommending And so I will bring that to the board president and Carol, and we can make that decision how that will work going forward. But critically important thing, but a very, very time consuming effort. And other than that, we've had a lot of things that are just the normal operation processes that are going on. But one of them that kind of jumped in the middle of there that was somewhat unexpected as we were doing all of this project is back in the year 2003, we moved up from the 5th floor in our building to the 10th floor. And at that time, it was basically a newly gutted and cleaned out office. And so we had carpet, the whole thing put in like you normally would. But not much has occurred since that point. And so our carpet became quite worn in places. And at the time, the state wasn't willing to fund the replacement effort for the full office about 1.5 years ago. But after the COVID funds and whatnot, there was some money left over. And so they offered that to us if we wanted to do it, but we had to make the decision very quickly and allocate resources for that. And so, Carol agreed that that was something that we needed to do, and we adjusted our schedules. And everybody, I can't thank all of the staff so much for working to help get that done, because it was supposed to be a three-week project, but we really knocked it out in basically 2. And the actual work itself was only 1 week with the contractors in replacing the carpet. So when or if we were ever able to meet in person, it'll be nice for you to come up and see the office. And so that was a wonderful effort to get that done. So I really appreciate everybody's help with that. But other than that, that's my report. I stand for any questions.
Any questions for Adrian? Okay, I'm going to move right down the list with committee reports. And the first one is the Education Committee. And that one belongs to me for the report. So I'm going to turn the meeting over to Rebecca. And I'll start with that report. And we have several motions that we'll go through. So my report is going to be brief. Education Committee is always has a lot on their plate. One of the main things that we talked about besides the motions that you're going to see is that we talked a little bit about the site visits for schools. Right now, there's quite a few of them on this fall. As you saw, or you could look at the list with Janelle's report. Some are on site, some are virtual, depending on what their request was. And the committee recommended that we stay with that format unless there was some change in numbers, or unless the agency had other direction with the government because of the type of agency we were, whether it restricted travel or any of those kind of questions that we had, then we would look at that and decide individually what we wanted to do. Right now, the administrator of the program helps decide whether that will be virtual or on face-to-face and what their preference we're doing. So we're working through that on an individual basis. What that means for spring, I have no idea. I guess we'll revisit it again in December. So that's the really only other report I had for the Education Committee, except for when we get to our petitions that we had, we did have some consideration with that about there were some petitions that for retest that were put in later past the August 13th was our deadline cutoff. It needs to be submitted 30 days before the packets are made. And the team did agree to extend that to the 31st of August so that those people that wanted to start taking care of their duties that they need to do to be retesting, they could start on that now, trying to help at least a little bit that we could, the burden of the nurse crunch and having a shortage. So the group decided that we would extend that to the 30th for this time. And those petitions will come in as a motion. So with that, I'm going to let Chelsea start with our motions. And we have a few of those to go through, and then that will complete my report for the Education Committee.
Is there a board member who would like to make the following motion? It was moved to approve the major curriculum change request for Barton Community College ADN program to establish a satellite site in Pratt on the campus of Pratt Community College to admit 30 additional students.
I will make that motion.
Do I hear a second?
This is Juliana, member. I'll second.
Thank you, Juliana. It has been moved and seconded. Is there any discussion? If not, all those in favor say aye.
Aye. Aye.
Opposed, nay. Any abstentions? Motion carried.
Is there a board member who would like to make the following motion? It was moved to approve the major curriculum change request from Johnson County Community College ADN program to change the nursing content to a lifespan model of delivery and to modify credit hours by increasing 1 hour for semesters 1 and 2, decreasing 1 hour for semester 3 and 4, resulting in all nursing courses being 9 credit hours except for the health assessment course.
This is Patsy and I so move.
Is there a second?
Gwen Lloyd, I'll second.
It has been moved and seconded. Is there any discussion? Hearing none, all those in favor say aye.
Aye.
Opposed, nay. Any abstentions? Motion carried.
Is there a board member who would like to make the following motion? It was moved to approve the major curriculum change request from Pratt Community College PN program to include IV therapy into the PN program beginning January 2022.
This is Patsy and I so move.
Is there a second?
Andrea Watson, I'll second.
Thank you. It has been moved and seconded. Any discussion? Hearing none, all those in favor say aye.
Aye.
Aye. Opposed, nay. Any abstentions? Motion carried.
Is there a board member who would like to make the following motion? It was moved to approve the major curriculum change request from Pratt Community College PN program to add a hybrid delivery method to the PN program beginning fall 2022.
This is Patsy and I so move.
Is there a second?
This is Melissa, I'll second.
It has been moved and seconded. Any discussion? Hearing none, those in favor say aye.
Aye. Aye.
Opposed, nay. Any abstentions? Motion carried.
Is there a board member who would like to make the following motion? It was moved to reapprove the PN programs on full approval status through December 2022.
This is Patsy and I so move.
Is there a second?
Vani Gonel, second.
Thank you. It has been moved and seconded. Any discussion? Hearing none, those in favor say aye.
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 Opposed, nay. Any abstentions? Motion carried.
Is there a board member who would like to make the following motion? It was moved to reapprove the ADN programs on full approval status through December 2022.
This is Patsy and I so move.
Is there a second?
This is Jade. I'll second.
Any discussion? All those in favor say aye.
Aye.
Opposed, nay. Any abstentions? Motion carried.
Is there a board member who would like to make the following motion? It was moved to reapprove the BSN programs on full approval status through December 2022.
This is Patsy and I so move.
Is there a second?
Gwen Lloyd, I'll second.
Thank you. It's been moved and seconded. Any discussion? All those in favor say aye.
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 Opposed, nay. Any abstentions? Motion carried.
Is there a board member who would like to make the following motion? It was moved to reapprove the 4 ADN programs, Colby Community College, Donnelly College, Fort Scott Community College, and Seward County Community College on conditional approval status through December 2022.
This is Patsy and I so move.
Is there a second?
Gwen Lloyd, I'll second.
Any discussion? All those in favor say aye.
Aye.
Opposed, nay. Motion carried. Oh, any abstentions? Motion carried.
This is the final motion. Is there a board member who would like to make the following motion? It was moved to approve the petition for permission to retest summary from May 15th, 2021 through August 30th, 2021, which includes Raquela Hernandez, Stephanie Burgeranovich, Carissa Aldrich, Sherry Williams, Jeanette Lima Nazario, and Helen Aguilar.
This is Patsy and I so move.
Is there a second?
Gita Noble, I will second.
Thank you. Any discussion? All those in favor say aye.
Aye.
Opposed, nay. Any abstentions? Motion carried.
That concludes my report for the Education Committee. And now I guess Becky and I will trade hats again, and
Yes.
she gets to give the report for Investigative Committee.
Okay. Pretty much Linda kind of summed it all up. We stay continually busy and processes of change, which are really working very well. And we have no action items for today, Madam Chair.
Thank you. Then let's move to the C&E IV Therapy Advisory Committee. Juliana.
Thank you, Madam Chair. We had a great meeting yesterday, and I think Chelsea summed it up very well in her report. So I am going to let her move forward with our motions.
Is there a board member who would like to make the following motion? It was moved to withdraw the approval status from the following delinquent C&E long-term providers: Atkins Physical Therapy and Ergonomics, Bailey Medical Services, Clay County Medical Center, Kansas Department of Health and Environment, Parsons State Hospital and Training Center, and Perinatal Resource.
This is Juliana, and I will make that motion.
This is Gwen Lloyd. I'll second.
I'm sorry, I'm losing my place. We have a motion and a second. Do we have any discussion? Hearing none, everyone in favor say yes.
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 Anyone opposed say no. Any abstentions? That motion carries.
Is there a board member who would like to make the following motion? It was moved to approve the long-term provider 5-year renewal application for Cloud County Health Center, LT 0273-0911.
This is Juliana, and I will make that motion.
This is Adria, and I second.
We have a motion and a second. Any discussion? All in favor say yes.
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 All opposed say no. Any abstentions? That motion carries.
Is there a board member who would like to make the following motion? I move to approve the long-term provider 5-year renewal application for Coffeyville Regional Medical Center, LT 0099-0316, pending the submission of an updated roster.
This is Juliana, and I will make that motion.
This is Lori Owen, I'll second.
A motion is second. Any discussion? All in favor say yes.
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 All opposed say no. Any abstentions? That motion carries.
Is there a board member who would like to make the following motion? It was moved to approve the long-term provider 5-year renewal application for Eagle Med LLC, LT 0208-0916.
This is Juliana, and I will make that motion.
This is Melissa. I'll second it.
We have a motion and a second. Any discussion? All in favor say yes.
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 Opposed say no. That motion carries.
Is there a board member who would like to make the following motion? It was moved to approve the long-term provider 5-year renewal application for Gertie, LT 0249-0916.
This is Juliana, and I will make that motion.
This is Gwen Lloyd. I'll second.
To have a motion and a second, any discussion? All in favor say yes.
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 All opposed say no. Any abstentions? That motion carries.
Is there a board member who would like to make the following motion? It was moved to approve the long-term provider 5-year renewal application for KC Hospice and Palliative Care, LT 0118-0916.
This is Juliana, and I'll make that motion.
This is Rebecca. I will second.
Motion is second. Any discussion? All in favor say yes.
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 All opposed say no. Any abstentions? That motion carries.
Is there a board member who would like to make the following motion? It was moved to approve the long-term provider 5-year renewal application for Newton Medical Center, LT 0209-0916.
This is Juliana, and I'll make that motion.
Giovanni Gonet, I'll second.
Motion is second. Any discussion? Everyone in favor say yes.
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 Opposed say no. Any abstentions? That motion carries.
Is there a board member who would like to make the following motion? It was moved to approve the long-term provider 5-year renewal application for Value Health, LT 0276-0911.
This is Juliana, and I will make that motion.
This is Rebecca. I will second.
Motion is second. Any discussion? All in favor say yes.
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 All opposed say no. Any abstentions? That motion carries.
This is the final motion. Is there a board member who would like to make the following motion? It was moved to approve the initial application for CE That Matters.
This is Juliana, and I'll make that motion.
This is Adri. I second.
Motion is second. Any discussion? All in favor say yes.
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 All opposed say no. Any abstentions? That motion carries. Thank you.
Thank you, Madam Chair.
So the next report is APRN, and I'm once again going to hand this over to Becky because that will be my report. APRN met yesterday. I'm the vice chair on that team. Not really, no motions that I remember. Jill, is that correct? We didn't have any motions?
Yes, that was correct.
Okay, thank you. A couple of team members that have been on there quite a while are now going off of that committee. So I just want to publicly say again, thanks for all that help for the last few years. I think they mentioned that they were going to continue to come, but they would not be a voting member on that team anymore. So we appreciate their help. Other than that, I don't think we had anything else, just general cleanup work that we need to do, so no motion. So that's my report.
Thank you, Patsy.
And then Becky and I are going to play ping pong and flip again. She has a report for,
Yes, I do.
for the practice committee.
Practice committee met, and Linda gave a little overview also of that committee. We had a good conversation about practice questions, and we're going to look into some resources to address some of those. And we also have one action item to vote on today. Is Victoria reading that?
Yeah, I have it.
Well, Victoria, I just want to explain to the group, this is KAR 60-7-103, which is a change of name for the licensed mental health tech. And there was a correction made to it. And if you're interested, I can refer you to this document. It's under the committee packet. KAR 60-7-103, change of name for anybody that wants to look. We just added a 30-day, within a 30-day window of completing, because it wasn't on there. It was open-ended, so we added a time frame to it. Okay, I'm done.
That's all
You
for
can
that.
read now. Victoria. You can
Okay.
read, Victoria.
Okay, thank you very much.
She needs to read it because I just explained what it was.
Okay.
Sorry. Is there a board member who would like to make the following motion? It was moved to approve KAR 60-7-103 to reflect the changes submitted.
This is Rebecca. I so move.
This is Adri, I second.
Motion and a second. Any discussion? All in favor say yes.
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 All opposed say no. Any abstentions? That motion carries.
That's my report. Thank you, Madam Chair.
Okay, thank you. And one more time, back and forth, I have the Finance Committee report. So I will take care of that. We did not have any motions in this meeting either. The budget submission was due today. Carol submitted that yesterday for the approval. It goes through several steps after this. Adrian mentioned in his report, and so did Carol, about the performance-based budget and the next steps that we would have with that. Carol mentioned that she would bring back some of those documents that we could look at and would put it in the December packet for the Finance Committee so we could look at that. So that'd be great, so we could see how that falls into place. A change in the package to take care of the licensing software update. That was one of the main things we had there. But other than that, that's all I have for that report. Okay. We're going to move to the next piece, which is unfinished business review of the draft statute revisions. Carol, would you give us an update of what we're really talking about here?
Sure. This is Carol Moreland. And starting on page 13 in your board packet, 13 through page 21 are the draft statute revisions. That would be 651120, 651120A, 651121A, 651129, 741110, and then the new impaired provider statute. This was discussed last meeting in June, and there were some changes that you wanted me to make. And so I did make those changes, and that's what you have in your packet now. So I guess I just need direction about what the next step would be that you want me to do. Because I had heard some discussion of trying to take it over there next session, which would be January. I'm not real clear on the next step.
This is Patsy. I've looked at these statute revisions, which everybody understands a statute is the law. You know, the regulations that we have, or the interpretation of that law. That's very simply put. I'm not a lawyer, but in view of the new membership that we have and the newness and the seriousness of some of the things that are here, I'm just going to suggest to the group that maybe we table this for right now and let the agency bring back with some information, maybe with the Attorney General. Charles can help us out with some of the details of what these statutes really mean. And when I say that, what it really entitles and what the differences they will make and what we'll be stepping into there. Just another information gathering piece. This is kind of a big step. Statutes are big things over in the legislation group. We want to be very careful and purposeful about how we introduce and when we do that. So if I don't have any opposition here, I would like to suggest that we come to the December meeting ready to have some information given to us that would help us know more about these revisions. Because I don't want to slight the investigative committee and some of the work that they're doing. And that's a suggestion I have for the group. Any comment? Rebecca and Juliana are both on that team.
I'm supportive of that, Patsy. I think given our environment and the number of new board members, I think it's important that we are all very aware of these changes and that we all can truly say we're supportive of them before they happen. So I would support tabling it.
And Madam Chair, I concur. There's a lot of new members, and these are statutes which are the law, and we have to live with them once they're approved. So we need to make sure that everybody truly reads them and understands them, and we have all the guidance and resources we need to make sure that they're going to work for us moving forward. So I support that.
So any other opposition or differences in opinion there? Well, Carol, I don't hear any. So does that give enough direction for what we need to do?
Sure, it sounds like maybe we need to bring some education in December and so that everyone can understand these better. So we will do that. Thank you.
Thank you. So we're going to move right into the next review of a draft regulation revision. Again, Carol.
Okay, that is actually in your packet on page 22, and this is a regulation versus the statutes that we just talked about. Again, I made changes that was recommended out of the last meeting, and so those are what you have in front of you. And just as a reminder, anything underlined in here is new information. That's kind of how we do it. Everything that has a strike through would be removed from the regulation if the proposed changes were approved. And so again, I'm not exactly sure how you want to proceed with this. If you want education on this also in December or what, because since this is a regulation, it would be handled a little bit differently. It's the one that would have to start through Division of Budget, Department of Administration, Attorney General's office, that whole process. So I just need a little direction, I think.
So even though this is a regulation, is it agreed with the group that we could put that in the same package of information and education that we could get in December? Okay.
Yeah.
Like I said earlier, I've been a part of this process for a long time, and I'm still very cautious about making sure I understand all the details of whatever I'm voting on. I really take that pretty seriously because it affects a lot of people. And I don't want to just hurriedly make the wrong move there. So unless we have some opposition, I think we'll add that to the group for the education piece in December. Okay.
Thank you.
Okay, we're moving to number 3, review of the draft strategic plan. I guess, Carol, you're going to need a raise or a chocolate bar or something.
Okay, thank you. This actually starts on page 24 in your packet. You directed us last time to take the strategic plan in the format that we have it right now, which starts on page 37. You can see the changes between the two formats. And we worked with Arthur Davis and got it into what I think is a little better looking format, but it's totally up to you all. It's the same content, it's just putting it in a different format. So I was directed to work with them and bring it back to you all to review and see what you thought. So just if you have any questions or.
I think it's a nice job. This is Gita Noble. It looks really good. Thank you.
Yes, I agree. It looks very professional. We've worked with the other format that's been very sufficient, but this looks pretty awesome. So thanks for the work, Carol, and the group.
Okay, great, thank you.
And okay, now we're jumping right to new business, which is review of the mission statement, something we do every year, correct?
Mm-hmm. Yes, that is correct.
So I'm going to read the mission statement, right? Is that, and we have a motion to accept it in order if we want to change that. To assure the citizens of Kansas safe and competent practice by nurses and mental health technicians. Some discussion about any need to change that or? Well, hearing none, I think Jill has a motion.
don't know, maybe we lost Jill.
She's muted.
Okay, there we go.
There we go.
You're muted, Jill.
There we go.
Sorry about that. For whatever reason, my screen I have this little tiny window and it doesn't give me that option. So I need to figure that out. So is there a board member who would like to make the following motion? It was moved to make no changes to the Kansas State Board of Nursing mission statement. Current mission statement reads, the mission of the Kansas State Board of Nursing is to assure the citizens of Kansas safe and competent practice by nurses and mental health technicians.
This is Julia, board member. I'll make that motion.
This is Gwen Lloyd. I'll second.
So the motion and a second. Any discussion? All in favor say yes.
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 All opposed say no. Any abstentions? Okay, that motion carries. The next thing we have is report on delegate assembly. Carol, that was a virtual event, correct?
It was a virtual event, and I actually put in my exec report, you know, the press release from delegate assembly, and I don't really have anything to add in addition to that, unless you do, Patsy.
No, it's National Council does a great job, but everybody across the United States trying to vote and get in there, and it's quite the operation, let me tell you. But I appreciate the effort, and we made it through it, and we're good to go. So the next thing on the agenda is December 2021 committee and board meeting. We need to have a little bit of a conversation about how we're going to handle the December meeting. Some of the suggestions that maybe have been brought forth is that I don't know if we're ever going to go back to a full meeting where we meet every quarter in Topeka altogether. I don't know. The COVID changed lots of things, and it may have changed some of that. Some of it has to do with travel. One of the things when we tried to look for a venue to have a meeting where we could social distance and have enough room for public to be there, that was very difficult to do in Topeka in the short amount of time from one meeting to the other. Also very expensive. I mean, in the thousands of dollars to secure that type of place to do that. So in brainstorming a little bit, I have a suggestion for us. And one of them would be that maybe we would do virtual for December, just for the simplicity of that. And then maybe consider that we would put into place maybe 2 meetings a year virtual and 2 meetings a year face-to-face, meaning we could combine those resources and maybe meet face-to-face, which is an important part of this group. But we could take that money, like $3,000 or $4,000 for the meeting of the day, and we could put that for 2 meetings instead of all 4. Just for some consideration for later on, but the immediate thing we need to decide is about the December meeting. Carol, your agency has been asked to go back to hybrid, right? Or
well, right now, the guidance is that we get as many people out working remotely if possible. We can't close down the agency or anything. So we're not even bringing them in 8 hours a week anymore. They can come in to do what they need to, such as check physical mail or, you know, something along that line. But other than that, we're keeping 70% of them out. If we do any kind of meetings during this time, and this goes until they'll reevaluate October 4th, the meetings have to be in an area big enough so that there could be social distance of everyone in attendance. So you're talking 11 board members, 6 staff members, 7 staff members. And then when you meet in person, we have to be able to provide space for the public to attend also. So we would need a venue big enough that we could social distance the board, the staff, and any public attending. And you also have to wear a mask. you know, for most of you, you didn't know this. We used to meet in the Landon building, which is where our agency is. We did not meet up in our agency, but there was a conference room down on the fifth floor. That conference room will not be big enough under these guidelines. There's no way. There's nothing else in the Landon building. There's probably, there might be a little bit within the state system, although we're running into the bigger areas being scheduled a lot because of this very reason. So we would probably have to go outside of state offices, and that's where the cost really starts to greatly increase. And plus we have to look at, do we have the IT that we need to be able to, you know, microphones and all of that stuff. I can't speak to all that. Adrian probably can. But anyway, so we just need a little bit of upfront time to make this happen, because a lot of these bigger places get scheduled out. And so it's very difficult for us to do it with 2.5 months, maybe 3 months upfront. So, you know, I'm not sure what the guidance will say after October 4th, but that's what it says right now.
So in giving the agency some guidance as to how we want to handle our board meeting in December, that's something we need to decide now. So any opposition to setting it up for virtual again? I know our comfort would be to do something different, but if I don't, is everybody okay with that, or do I have some opposition? If not, that would be the guidance that we give. And this didn't just give some consideration to have a discussion at the December board meeting about the 2 and 2, whatever we do. You know, some suggestion was maybe the March meeting would be virtual, the June and the September meeting would be in person, and then the December again in virtual. That's just an idea. June is a little better weather. September is usually our administrators update, especially for education. That's a big one for us. Those people usually come together. Schools are getting started and rolling. So just, and maybe you guys would come up with another idea or something else we can do. Like most of you, I think we've all gone to bed at night and hoped that we would get up the next morning and this pandemic would be on down the road and we would be back to some kind of normalcy. I don't know if that dream is ever going to come true. So I think we need to find a way to work through that. And we have to give the agency some time to plan that. Plus the budget doesn't allow for us to spend that kind of money every meeting time that we would meet together or not. And for some of us, when we go, like myself, when I would go to Topeka, it would be long 3 days and possibly 4 days. I would be on travel to be able to take care of the board meeting. And my school agreed to that, and I made arrangements to do that. But sometimes that was a real struggle to be gone that many days in a row. So something to think about. Maybe somebody has another idea, that would be great. But if it's okay with everyone, let's put December on for virtual. That would be committees, etc., board meeting. And then some more discussion about how we'll handle this from here on, and maybe some insight about what we could do from there. I mean, I brainstormed with Kara a little bit, and she even said maybe we could do something fun like go to the lake or do something, you know, who knows what they'll come up with. That would be great. Adrian, you have a comment?
Yes, Madam President. One other thing to consider as well as you're thinking through this process, whether or not we continue forward doing the streaming of the meetings. You know, it's kind of became the norm and the expectation, but depending on how we set up these in-person meetings versus the virtual meetings and whatnot, if we were going to do them in conjunction, you know, streaming them for the public, we would kind of need to know that too. So
I appreciate that input. Yeah, we need to set some guides as to how we're going to handle all that. Makes a little bit difference with the equipment, et cetera, et cetera. So, okay, any other discussion there? Are we good? Okay, number 4, draft revision KAR 60-3101 and 60-11-103. Carol, I'm going to lean on you again. That has to do with some, with military, didn't it?
Right, it does. This is Carol Moreland, and starting on page 42 in your board packet, it starts with KAR 60-3-101. These are proposed changes that have been made in response to a bill that passed last legislature that basically talks about expedited licensing for military spouses, someone living in Kansas or wanting to relocate to Kansas. So it's basically having to do with endorsements. We kind of use this opportunity to kind of clean up this regulation. So what you have 60-3-101 would be for RNs and LPNs, and then 60-11-103 is actually for APRNs. And so what you have in here is you have a temporary and then a permanent. These have been going through the system for months now, trying to get everything through. Again, it's not an easy system, but anyway, we're working on it. So I did have these in June because I did start these the first part of June. And there's been some changes from what you saw in June. So I just wanted to put them back in here and just ask if you would approve, look them over, see what questions you have, and then approve the proposed changes for the temporary for 60-3-101 and the permanent for 60-3-101. And then same thing, the temporary for 60-11-103 and the permanent for 60-11-103. I'll entertain any questions. I will just tell you the big that have been since what you saw in June is grammar stuff. There's been a real holdup with the grammar and getting it through Department of Administration. And I think that's where it may still, I'm not totally sure. But anyway, everything that's underlined in here would be content. Again, the strike throughs, if this gets all everything would not show up in the new regulation that's been revised, just to kind of let you know. So I don't know if you have questions, or I wasn't kind of planning on going through each of it, but it's up to you.
So just an update as to what the process, where they are in the process, correct?
Right, and just for you guys to approve them as they are right now, since there were some changes from when you looked at them in June, but they're not substantial changes. They're truly grammar and some changes in the history and stuff like that.
So we have a motion for that, correct, Jill?
Yes.
Okay.
Is there a board member who would like to make the following motion? I move to approve the temporary and permanent revisions for KAR 60-3-110 and KAR 60-11-103 as written.
This is Ed. Go ahead. This is Adri. I so move.
We have a motion. Do we have a second?
This is Juliana. I'll second.
Motion is second. Any discussion? All in favor say yes.
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 All opposed say no. Any abstentions? Okay, that motion carries. Okay, we've come to election of office. I'm sorry.
We have another motion for
you do.
60-11-103. Do we not, Jill?
Oh, I'm sorry. I thought I
Did it say it in there?
Yeah, I included it.
Oh,
in
okay.
this.
Sorry. Never mind.
No problem.
Never mind.
Okay. That's okay. When we get to Wednesday of these weeks, done Monday, Tuesday, and Wednesday, we're all really there. I don't know if you've been in the whole process, you'll understand someday, but it's quite a lot. I appreciate the help, Jill. We got it. Okay, let's move on to election of officers. And I talked to Carol a little bit because I'd like her to explain a couple things, because we have some other appointment of agency head and presiding officer, some more decisions we have to make after we have the election of officers completed. So Carol, I'll let you talk to that.
Okay, thank you. Just some things I asked to have these two moved around, the election of officers first, and then the appointment of the agency head and presiding officers. Just one thing I want to bring to your attention to avoid any conflict of issues. Whoever becomes president cannot be on the investigative committee. And you'll kind of see that play out as we get into some of the delegation and things like that, but really to avoid any conflict of interest. Just be aware of that. And I think we can talk maybe a little bit more about the delegation motions when we get to those. I don't know, Charles, if there's anything you want to say before they do election of officers or. Charles is our legal counsel from the Attorney General's office.
Yes, hi, Charles Macheras, your general counsel here. Generally, to avoid conflict of interest, the president's not on the investigations committee. It's kind of analogous to a prosecuting attorney can't be the judge or jury as well. So they're separate roles.
Thank you, Charles.
Okay, thanks for that. So when we do elections, we open the floor up for nominations. Do we have to do a roster vote or can we just, everybody in favor? Can we just do that? Carol? Okay. Yeah. So the three positions we're looking for are for the executive team. That would be the president, vice president, and secretary. Is that correct?
Yes.
So let's start with the presidency. And the floor is open for nominations for that position.
I have a nomination for Juliana for
Thank
president.
You, okay, a nomination for Juliana. Any other nominations? Hearing none, I will go right to the vote. Everyone in favor of that nomination for Juliana for president of the State Board of Nursing, please say yes.
Yes.
Yes. Yes.
Yes.
Anyone opposed, say no. Any abstentions? That would be Juliana.
I'll abstain.
Then,
Thank
Madam
you very much.
President, I'd like to make a motion off of that one, sure.
Okay, I will let you do that.
So is there a board member who would like to make the following motion? I move to elect Juliana Resnick as president.
Giovanni Gone, board member. I make that motion.
Gwen Lloyd, I second.
Looks like a motion is second. I guess we'll go through the vote again. We have a motion to, any discussion? Sorry. I didn't know you had a motion, Jill, written out, so I'll take care of that next time better. So.
No problem.
Everyone in favor say yes.
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 Opposed say no. And any abstentions?
I abstain.
Looks like that motion carries. Welcome, Juliana. You'll do a great job. Congratulations.
Thank you.
Let's move to vice chair. And the floor is now open. And Jill, I'll try to do this correct this time.
Okay.
Is there a nomination for vice president?
This is Juliana, and I'd like to make a motion that Rebecca Saunders be the vice president.
Thank you for that. Any other nominations? Okay, Jill, I'm going to let you have the floor this time.
Okay. Is there a board member who would like to make the following motion? I move to elect Rebecca Sander as vice president.
This is Jade Ramsdahl. I'll make that motion.
This is Adria, second.
Motion in a second. Any discussion? All in favor say yes.
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 All opposed say no. Any abstentions?
Abstain.
Thank you. Looks like that motion carries. Congratulations, Rebecca.
Thank you.
Okay, now we'll move to secretary. The floor is open for nominations for secretary position.
I nominate Jade.
This is Juliana Ishik. I'd like to nominate Adri Goldsmith.
Okay, so we have two nominations for that position. Any other nominations? Okay, Carol, I'm going to ask, how do I handle this? Do we just do a roll call here?
Yeah, you'll have to. Yeah, I mean, we can't do ballots per se. Yeah.
Okay, will you do the roll call then for those two persons?
Okay.
So the roll call will
Need a
be,
motion first for Jade, and then probably a motion for Audrey.
just for the
Would be
nomination,
voting one or the other, right?
just for the nomination. Yeah, could we have? They're on the
So you're
ballot.
wanting a motion for each one of them? Am I understanding correctly?
Yeah, I believe you'll have to and
Okay.
vote on each one because you would be voting for one or the other. Okay, does that make sense?
Okay, yes.
Okay.
So is there a board member who would like to make the following motion? I move to elect Jade Ransdale as secretary.
This is Leah Noble and board member, and I will make that motion.
This is Gwen Lloyd. I'll second.
So motion and a second. Any discussion? And now we're going to go through the roll call, correct, Carol? To see whether we, yes or no. Okay.
Yes. Jill, do you want to help keep track of the numbers?
Yes.
Okay.
All right. Patricia Zeller.
My vote is no.
Okay. All right. Rebecca Sander.
No.
Okay. Juliana Ryshik.
No.
Adri.
Yes.
Gwendolyn.
I'm abstaining.
Okay. Andrea.
Yes.
Melissa.
Yes.
Lori.
I'm abstaining.
Giovanni.
My vote's no.
Gita.
My vote is yes.
And Jade, I presume, is abstaining.
That is correct. Thank you.
Okay, so I have 4 yeses, 4 nos, and 4 abstaining. That can't be right. 3 abstaining. That comes out to be 11. Is that what you got, Jill?
That's what I have.
Okay, so we have 4 yeses and 4 nos.
So.
Well, let's go ahead and do Audrey and see if Audrey gets more votes yes. How's that?
Okay.
Okay, is there a board member who would like to make the following motion? I move to elect Audrey Goldsmith as secretary.
This is Juliana, and I'll make that motion.
Giovanni Gonet, I'll second that.
Motion and a second, any discussion? Hearing none, I'll let you do the roll call.
Okay, Patricia Zeller.
Yes.
Rebecca Sander.
Yes.
Juliana.
Yes.
Adri, I presume you're abstaining. Gwendolyn.
I'm abstaining.
Andrea.
No.
Melissa.
No.
Lori.
Abstaining.
Giovanni.
Yes.
Gita.
No.
And Jade.
Yes.
Okay, I have 5 yes, 3 no, and 3 abstain. Is that what you have, Jill?
Yes.
Okay, so Andrea had 5 yeses, Jade had 4 yeses.
So it looks like Audrey will be the secretary if she will accept that position.
I'll accept.
Okay, thank you. Well, that was a stretch for the Robert Rules of Order. Thank you very much. Okay. Okay, congratulations to everyone that has those positions. The board is great, awesome with help. I do not hesitate at all if I have a question or struggle with something I'm trying to figure out or connect with or whatever. Great help and make that process pretty easy. So let's move on to the next thing, which is the last thing on the agenda, I think, for the appointment of agency head presiding officers. We probably need some explanation. There are several delegation pieces there, aren't there?
Yes.
So you want to explain each one before we go to that?
There's like 7 motions.
Oh, okay.
And some of these are rather long motions.
Okay.
I don't know, Charles, do you want to explain this or how do you want to do this? Charles and I have had several conversations about these.
Yes, we have. So in the statutes and regulations, the board has its power, but it also has the authority to delegate that authority because there's just, you guys have a giant board with tens of thousands of licensees and lots of sub-boards. So you have the authority to delegate some activities to subcommittees and things. And so that's basically what we're doing here is once a year, the board has to delegate its authority to the subgroups to do some of those activities. So that's what we're doing here. Does that make sense?
Yeah, I think so. And then maybe after we read these, if each one, if they have more questions, does that work for you, Charles?
Yeah.
Okay. Jill, do you want to read these or you want me to, or what would you like?
Yeah, I can read them. I may need some assistance as far as some questions, but I can start out reading them. I don't have a problem. Are you ready for the first one?
Yeah, and then they'll have to decide who they're going to delegate it to.
Okay, the first one, is there a board member who would like to make the following motion? I move that pursuant to KSA 77-527 of the Kansas Administrative Procedure Act, the board designate and delegates to, and then we'll need to fill that in, its authority as agency head to review, decide, and issue any orders concerning petitions for review, petitions for reconsideration, and motions for stay filed with the board, and taking any other action related thereto until further action by the board.
And just as a kind of thought on here, this can't be anybody that's on the investigative committee. And it probably is going to need to be a nurse because some of what they're going to be reviewing or have the potential to review are cases that would have to do with nursing actions. So if they have some knowledge of nursing, it's going to be extremely helpful. I don't know, Charles, is there anything else you want to say? Or Patsy, you've kind of been the one doing this as far as reviewing the petitions and stuff like that. So I don't know if you want to say anything either.
So the committee assignments are going to be taken care of after this meeting sometime with the requests that everybody put in, what they were interested in. Those committee assignments will be made. So when we make this assignment, this person will not be able to be on that investigative committee. So yeah, it's a lot with scope of practice. Lots of times that's involved in it. So RN is probably the best choice. It does take some time. You don't really have a lot of them. I haven't had in the last, 6 months, a lot, but it's serious stuff. So you have to be able to designate some time to the volume of reading that you would have to do for that one case. It's nothing like investigative committee has to go through, but it was, I took it pretty serious. So Any other questions? Hearing no other questions, I'd like to nominate Juliana for that position.
I second that.
Motion and second. Any discussion? Not hearing any. All in favor say yes.
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 All opposed say no. Any abstentions?
I abstain.
Looks like that motion carries. So Juliana has another hat to wear. There you go.
Okay. The second motion is there a board member that would like to make the following motion? I move that should Juliana be unable to serve as agency head, the board designates someone to serve as the alternate agency head, and in such circumstances, the board delegate to, and then that's going to be blank as well, is its authority pursuant to KSA 77-527 of the Kansas Administrative Procedure Act to review and decide and issue any orders concerning petitions for review, petitions for reconsideration, and motions for stay filed with the board, and taking any other action related thereto until further action by the board.
So again, this would just be a backup to Juliana is what we're talking about here. So again, they can't be on the investigative committee, needs to be a nurse. And Charles and I didn't really talk about this, but since Juliana has been on the investigative committee, if there were any petitions that were filed that she was involved on the investigative committee, she would not be able to do this for that particular one, correct, Charles?
Yes, she'd have to abstain from that one because it would be a conflict of interest.
Yeah, so we might be going to this person in those instances. And I forgot to say that when we get these and everything, Juliana and whoever this person would, they actually work with Charles on these. So just kind of let you know.
I might just add, so Jan Arndt worked with the nursing board for several years, I think at least 8 years. And I think she said in all of her time doing that, there was only 1 or 2. But on the other hand, you just had 2 this summer. So
Yeah.
you never know how many there's going to be.
Yeah.
Yeah.
So we need a nomination for that position.
Mm-hmm. Madam Chair, this is Juliana, and I'd like to nominate Andrea Watson.
This is Patsy, and I second that motion. So a motion and a second. Any discussion? Hearing none. All in favor say yes.
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 Opposed say no. Any abstentions?
I abstain.
It looks like that motion carries, and congratulations, Andrea.
So I just have one question on
Sure.
that. So on because there was 3 lines that needed to be filled in. So I move that should Juliana be able to serve as agency head, the board designates Andrea Watson to serve as the alternate agency head, and in such circumstances, the board delegate to, is that going to be
Andrea.
Juliana?
Andrea.
Okay.
Yeah.
Andrea. Yeah.
Thank you.
Thanks, Jill.
You're welcome. Okay, so the next motion, I move that, or is there a board member who would like to make the following motion? I move that the board designate and delegate to the chair of the investigative committee the board's authority to, 1, make a reasonable grounds determination pursuant to KSA 65-1120B and amendments thereto of the Kansas Nurse Practice Act regarding matters that have been recommended for emergency proceedings by staff or council, and 2, act as presiding officer pursuant to KSA 77-514G and 77-551A and C, and amendments thereto of the Kansas Administrative Procedures Act to contact emergency proceedings and issue an order as required by KSA 77, excuse me, 536 on all matters that are being or have been investigated for any alleged violation of or compliance with the Kansas Nurse Practice Act or regulations adopted thereunder, unless the president determines the emergency proceedings should be conducted and decided by the investigative committee.
So did that motion need a name, or is it just, it designated the head of the investigative committee, the chair?
It just mentioned the chair, so it doesn't
Okay.
have to have a specific name.
So we need a motion for that. Who would make that motion?
This is Juliana, and I'll make that motion.
Can I interrupt for 1 minute?
Sure.
Carol, instead of president, should that be the chair of the investigative committee?
Yeah, at the end,
Yeah.
I saw that too. So Jill, it would actually say, at the very end of number 2, it would say, unless the chair of the investigative committee determines the emergency proceeding should be conducted and decided by the investigative. We missed that one.
Okay.
Okay, so we have a motion. Do we have a second?
Andrea Watson, I'll second.
Motion and second, any discussion?
Just to kind of clarify for everybody what this is this would be any emergency proceedings that needed to take place. And truthfully, we don't have very many of these. Doesn't mean that we never do, but there might be times in which we would get a complaint or something to us that truly elevates to an emergency proceeding. And it's happened a few times, but not very much. But that's kind of what we're talking about here.
Okay, a motion and second. Any other discussion? All in favor say yes.
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 All opposed say no. Any abstentions? Okay, that motion carries.
Is there a board member who would like to make the following motion? Subject to motion number 30 regarding delegation to the chair of the investigative committee. I move that if the chair of the investigative committee is not available to act as described in motion 30, the vice chair of the investigative committee is so designated and delegated to act as described in motion number 30.
This is Rebecca. I shall move.
I have a motion. Is there a second?
This is Melissa Orpeza, board member. I'll second.
Motion is second. Any discussion?
Now, this is just a backup to if the chair cannot do it, then the vice chair would do it.
Okay. Any other discussion? All in favor say yes.
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 Opposed say no. Any abstentions? That motion carries.
Is there a board member who would like to make the following motion? I move that the board designate and delegate to the chair of the investigative committee the board's authority to, 1, issue to an applicant meeting the qualifications and requirements of the Kansas Nurse Practice Act and the Nurse Licensure Compact Act, any license, certificate of qualifications, or authorization to practice nursing. 2, conduct hearings, enter into settlements, and issue decisions regarding the assessment of fines pursuant to KSA 74-1110 and amendments thereto, involving an allegation that a person who submitted an initial renewal, endorsement, or reinstatement application for any license, certificate of qualification, or authorization to practice nursing has violated or not complied with the Kansas Nurse Practice Act or regulations adopted thereunder. 3, making reasonable grounds determination pursuant to KSA 65-1120B and amendments thereto regarding applications that are being investigated or have been investigated for any alleged violation of or compliance with the Kansas Nurse Practice Act or regulations promulgated thereunder by the board. And 4, act as presiding officer pursuant to KSA 77-514G and 77-551A and C, and amendments thereto of the Kansas Administrative Procedures Act to review, decide, and issue any orders on matters involving all applications, whether initial, renewal, endorsement, or reinstatement for any license, certificate of qualification, or authorization to practice nursing that have been investigated for any alleged violation of or compliance with the Kansas Nurse Practice Act or regulations adopted thereunder. Such delegations include, but is not limited to, sending warning or reprimand letters, entering into settlement agreements, conducting CAPA proceedings and hearings, issuing pre-hearing orders, issuing initial orders denying or imposing limitations on any license, certificate, or authorization to practice nursing under the Kansas Nurse Practice Act, and taking any other action related thereto, unless the president determines the matter should be sent to the Office of Administrative Hearings for further proceedings or considered and decided by the investigative committee.
Okay, is that the duties we're going to, the question is to give those to the chair of the committee?
Yeah, the chair of the investigative committee. This has to do with the applications.
Okay.
Yeah.
So I need a motion for that.
This is Juliana, and I will make that motion.
I have a motion.
Giovanni Gone, I'll second that.
Thank you. A motion is second. Any discussion? All in favor say yes.
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 All opposed say no. Any abstentions? Motion carries.
Okay. Is there a board member who would like to make the following motion? Subject to motion number 32 regarding delegation to the chair of the investigative committee. I move that if the chair is not available, the vice chair of the investigative committee is so designated and delegated to act as described in motion number 32.
And this is Juliana. I'll make the motion.
I have a motion. Do we have a second?
This is Rebecca. I'll second.
Rebecca seconds. The motion is second. Any discussion? All in favor say yes.
Yes. Yes.
Opposed say no. Any abstentions? The motion carries. Do we have one more to go?
2 more to go.
2 more.
Okay, 2 more.
We're almost there.
Okay.
This next one's kind of a long one as well. Is
Okay.
there a board member who would like to make the following motion? Subject to motion number 32 regarding delegation of applications and motion number 32 regarding delegation of emergency proceedings, I move that the board designate and delegate to the investigative committee its authority to 1, conduct hearings, enter into settlements, and issue decisions regarding the assessment of fines pursuant to KSA 74-1110 and amendments thereto involving an allegation that a person who was granted a license, certificate of qualification, or authorities or authorization to practice nursing has violated or not complied with the Kansas Nurse Practice Act and or regulations adopted thereunder. 2, make a reasonable grounds determination pursuant to KSA 65-1120B and amendments thereto of the Kansas Nurse Practice Act regarding persons who were granted a license, certificate of qualification, or authorization to practice nursing and are being investigated or have been investigated for any alleged violation of or compliance with the Kansas Nurse Practice Act or regulations adopted thereunder. And 3, act as presiding officer pursuant to KSA 75-514G and 77-551A and C, and amendments thereto of the Kansas Administrative Procedures Act to review, decide, and issue any orders on all matters that have been investigated for any alleged violation of or compliance with the Kansas Nurse Practice Act or regulations adopted thereunder. Such delegation includes, but is not limited to, sending warnings or reprimand letters, entering into settlement agreements, conducting reviews, proceedings, and hearings, issuing pre-hearing orders, issuing initial orders that censor, revoke, limit, or suspend any license, certificate, or authorization to practice nursing under the Kansas Nurse Practice Act, and taking any other action related thereto unless the investigative committee determines that the matter should be sent to the Office of Administrative Hearings for conducting further proceedings and issuing an initial order are considered and decided by the board.
Okay. Any more explanation, Carol?
Not really. You're just delegating to the investigative committee to do this, which is how it's done. Yeah.
So I need a motion.
This is Rebecca. I'll move.
We have a motion. Do we have a second?
This is Adria, second.
Motion and second. Any discussion? All in favor say yes.
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 All opposed say no. Any abstentions? That motion carries.
Okay, and here's the last one. Is there a board member who would make the following motion? I move that should a board member serving on the investigative committee be unable to serve as a presiding officer in a matter pending before the investigative committee, we'll need to come up with a name here, is designated and delegated as an alternate presiding officer of the investigative committee in that pending matter.
So this could be any board member that's not going to be on the investigative committee. So that's kind of why we had to do these before we do committee selections and stuff like that.
So we need a nomination for that person?
Yeah, you need a name. Yeah.
Need a name.
So I won't be on the investigative committee.
That's correct.
That's correct.
So you could take that position, Juliana, correct?
I think so, if I'm reading that right.
Yeah, I think so. Correct, Charles? The board president could do that.
I think we were talking that who do we have in the minutes now, or who's doing it currently?
I don't know. We can look up.
It's probably got my name on it.
It might have Patsy's.
And I've never been on the investigative committee ever, but I was the president, so.
Sorry, I'm looking. I just have to get there.
I think it can be anyone except the board president. So there's 3 members of the investigative committee. If one of them was absent on this particular day of this meeting, this would be the substitute that would fill in for that day.
Patsy, would you, I'd nominate Patsy Zeller.
I second that.
Okay, but I will only be here till June, so the last few months, you'll have to make another exception to that after that, so. But I can do that.
Well, and historically, we've gone with a quorum on investigative committee. 2 of the 3 present made the decision.
That's right.
Okay, well, to keep the paperwork straight, can we put my name down for that and vote on that for today? And then we'll have to do another event to take that place after June.
Okay.
Okay. And that looks like that will work for everybody for the time being anyway. Then we can straighten out the other 2 or 3 event. Okay, so we have so Jill, you read the motion.
Yes.
So I guess.
So Juliana made that motion, and then who was the second on that motion?
I did. Rebecca. I did.
Rebecca, okay.
Yeah.
Okay. So a motion is second, any discussion? All in favor say yes.
Yes.
Yes. Yes.
Opposed say no. And I'm going to abstain. So motion carries. So Jill, are you satisfied with all of that being done now?
Yes, I am.
Okay. That is huge. I know when you try to read that stuff, your tongue gets tied, doesn't it?
Yes, it does.
It's tough. Anything else, Carol, that we've left out there?
I don't think so. Thank you all for waiting through that with us.
The last thing on here is the agenda for the December meeting, and I think we're going to bring back some more information about the CE broker. Also, what else?
You wanted some education started on these statute revisions.
That's correct.
And the regulation. So I don't know if you want them all done at the same time, or you just want to take them in pieces, or because it might be a lot all at once, but.
What is your suggestion? It is a lot of information all at once. Are they similar enough that we need to do them together, Juliana, Becky, or do we need to break them apart?
Those statutes?
Yes.
I don't know. There's some real short ones in there. 1120 is the big one. You know, that's the one that probably has the biggest impact. And 1120A. And then they get there's some that's very, very short. It's mostly 1120.
What do you want them doing as a package, Juliana, or what do you want to do?
Well, what do you think, Juliana? As a package or?
Let's do it as a package. Let's do it as a
is short, is the little one.
Yeah.
1129 is little. Impaired provider is an original. I mean, the impaired provider one has been originated, you know, it's brand new. And that's another one that we have to read through it very carefully. Make sure it's going to work for us. Yeah.
So I just put that out there. That's going to be a full package. So just prepare yourself. That meeting may be a little longer because it will take a while to get through all of that. So come prepared to eat snacks along the way or whatever. I don't know. So thank you for that. So is any other questions, Carol?
No. That's it.
Okay, well, like the next thing is adjournment and we don't need a motion for that. So thank you for all your work. And your help. Sure.
Oh, Madam President, may I make just a quick logistical comment, update?
Yeah, you bet.
Okay. As a reminder, to new members, you're going to be getting an email here in the coming days. It's going to have a link to information security assessment that we're required to have all members of the board and staff go through. Takes about an hour or so to do it, but it's a lot of videos, great, useful information. And any of the existing members, if you haven't completed it, if you could get that done for me as soon as possible, we would appreciate it. And then lastly, if you have any issues with your iPads or emails, if you could let Colton and I know as soon as possible so that we have a little bit of lead time prior to the next meeting so that we can get anything corrected. That's it. Thank you.
The things that we need checked off for security, that's not our demand, that's somebody bigger than us, and we will be checked on that. So if you need to get that done or need some help with that, make sure you talk to Colton or to Adrian and they can walk you through whatever you need to. I did it, so I'm sure you guys can handle it. So, but if you'd make that a priority, we'd appreciate it. So thank you. Okay,
thank you.
Let's adjourn.
Madam Chair,
Yes.
I just wanted to say thank you to you. You've served for president for several years during a pandemic and uncharted waters, and the dedication and commitment to our profession is very much appreciated, Patsy. You've done a lot.
Thank you very much for that. And, you know, and did it from my living room, right? The corner of my COVID corner, I call it. So yeah, no problem. Thanks for that compliment. I appreciate it. Okay, we'll adjourn and we'll see you at the special meeting and then in December. Thank you.
All right. Thank you.